Ladies and gentlemen, good morning. Welcome back to the second International Parasite Resource Bank Symposium 2021. Ladies and gentlemen, yesterday several things were discussed and several important agenda were come in front. By following this, today we are going to start our day. The day 2 of International Parasite Resource Bank Symposium 2021 will start by a session of plenary session. The plenary session will be chaired by Professor Kesones Om. Now, I request Professor Kesones Om to chair the session.
Thank you. Good morning. This is the second date of International Symposium for iPRB. We have two plenary speeches in this morning, and the first one will be delivered by Dr. Professor Maria Teresa Galán Puchades from University of Valencia, Spain. She is well-renowned parasitologist, and she is going to give with the title of COVID-19 and neglected parasitic disease, impact of the pandemic on the control of filariasis and dracunculiasis. Please, Dr. Galán Puchades.
Greetings from Spain to everyone. First of all, I would like to thank Professor Om for his kind invitation to participate in this second International Parasite Resource Bank Symposium. Unfortunately for me, online again. I deeply hope that next year we can meet face-to-face again. Well, in this today's world in which COVID-19 pandemic and parasitic diseases coexist, the title of my contribution is, give me a sec, COVID-19 and neglected parasitic diseases, impact of the pandemic on the control of filariasis and dracunculiasis. According to World Health Organization, neglected tropical diseases are a diverse group of around 20 conditions which are caused by a variety of pathogens such as viruses, bacteria, and parasites, protozoans, helminths, and arthropods. NTDs affect 1 in 6 people worldwide, and over half lives in areas where they could become infected. And while most entities are concentrated in tropical areas of Asia, Africa, also South America, some of them can be found all over the world, including wealthy nations. Of these 20 entities, 12 are parasitic diseases, specifically Chagas disease, dracunculiasis or guinea worm disease, echinococcosis, foodborne dermatodiasis, human African trypanosomiasis or sleeping sickness, leishmaniasis, lymphatic filariasis, onchocerciasis or rivet blindness, scabies, and other ectoparasitosis, schistosomiasis, soil-transmitted adventiasis, and teniasis and cysticercosis. Therefore, these are neglected parasitic diseases. Although neglected parasitic diseases, or entities, generally speaking, can also affect countries from the first world, they mainly affect impoverished countries like those shown in this map. In this map, we see the number of poor people by country. So we have countries with more than 100 million of poor people, those between 10 and 100, etc., and mainly in South America, in Africa, and in Asia. Particularly, this contribution refers three neglected parasitic diseases: onchocerciasis or river blindness, lymphatic filariasis or elephantiasis, and dracunculiasis or guinea worm disease. According to WHO, in its global plan to combat neglected tropical diseases in this period, 2008-2015, the entities were distributed into three different groups. I have underlined only parasitic diseases. Then dracunculiasis as well as lymphatic filariasis were placed in the tool-ready diseases to be eradicated by 2015. The same as onchocerciasis in the group of other tool-ready diseases. However, the plan was not achieved by 2015, and then in 2017, dracunculiasis was estimated to be eradicated by 2020. The same as in the case of onchocerciasis, elimination in selected countries by 2020, and lymphatic filariasis, global elimination by 2020. In this sense, to combat entities and in order to reach these goals by 2020, the known as London Declaration on Neglected Tropical Diseases was endorsed by many companies, ONGs, donators, etc. However, despite all the effort, these goals were not achieved by 2020, and WHO updated the roadmap for the entities to reach the objectives by 2030, this period, 2021-2030. Concerning dracunculiasis was targeted for eradication by 2030, because in the 100% of all the affected countries, in all of this, dracunculiasis will be eradicated. The prediction is not that optimistic for onchocerciasis, because in this case is target for elimination, not eradication. Elimination means the interruption of transmission. It will take place in only 31% of the affected countries. But is the prediction more optimistic in the case of lymphatic filariasis, because in 181% of the affected countries, lymphatic filariasis will be eliminated. Okay, let's start by onchocerciasis. This parasitic disease is produced by Onchocerca volvulus. Then let's have a look at the main features of these neglected parasitic diseases. This is a two-host life cycle involving humans and the vector. The vector are black flies of the Simulium genus. When humans are bitten by the infected fly, the infective Onchocerca volvulus larvae is deposited on the skin, entering through the wound. Normally, larvae remain near the point of their entrance, and they turn into adult stages several months later. The adult stages usually live in skin nodules, known as onchocercomes. Females produce thousands of small larvae, the microfilariae, which migrate through the skin. Then, when black flies bites again, in order to feed on human blood, ingest the microfilaria that will turn into infective larvae in the vector. The burden of the disease was calculated in 2017. About more than 21 million of affected people in the world, and people living at risk in 2019, more than 218 million population at risk in 2019. Well, let's have a look at different images of these skin nodules, the onchocercomes, that they per se do not cause special damage or symptoms. The problem is that onchocercomes are the source of microfilaria to the skin. And a female can produce between 0.5 and 1 million of microfilaria per year, and they can live about 12 years. That means that a heavy infected person can harbor millions of microfilaria in the skin, causing the skin disease, mainly due to the inflammatory process after the death of the microfilaria. So these images illustrate the deterioration and degeneration of the affected skins. And when microfilaria reach the eyes, this happens when the oncocercomes are located near the eyes, they finally cause blindness. It is known as the river blindness because Symposium, the vector, has an aquatic life cycle in fresh water. That is to say, its life cycle takes place in rivers. People living near the rivers are at a great risk of becoming blind. Regarding onchocerciasis control, this is based in human chemotherapy and in vector control. These are the different onchocerciasis control programs. In Africa, the first started in 1974, onchocerciasis control program. And in America, started in 1991, the onchocerciasis elimination program in the Americas. Subsequently, in Africa, started the African program for onchocerciasis control. And this program, the APOC, is now currently included in the program for elimination of neglected diseases in Africa, in addition to lymphatic filariasis. In 2007, started the AWOL. The AWOL consortium was created by Bill and Melinda Gates, aimed to the obtention of treatments against Wolbachia. Wolbachia is an endosymbiont bacteria of certain filarias, necessary for the development and growth of the disease of the nematode. So killing the bacteria, Oncocerca cannot develop. And this is a current project. The same as the TOVA initiative. TOVA means the onchocerciasis vaccine. The first trials in humans were expected to be by 2017, but currently these trials are expected to take place by 2025 and phase 2 by 2030. Therefore, the current core strategic intervention for the control of the river blindness, in addition to vector control, is preventive chemotherapy. Mass drug administration with ivermectin once or twice yearly. These are the million of people requiring this preventive chemotherapy, mainly in Africa. In Africa was calculated in 2019 that more than 200 million people require this preventive chemotherapy, mainly in African countries. Because in the Americas, onchocerciasis has been eliminated with the exception of a small focus in the Amazon. Now, let's have a look at lymphatic filariasis. It's produced by 3 species, Buccaria bancrofti, Brugia malayi, and Brugia timori. This is also a two-host life cycle involving humans, and in this case, the vector is are mosquitoes of the Culicidae family. When infected mosquitoes bites, the infective larvae is released on the skin and penetrate through the wound, the same as in the case of onchocerciasis. But in this case, this lymphatic species, the larva migrates to the lymphatic system, where turned into adult stages several months later. As a result of this blockage of the system, elephantiasis symptoms appear. Females produce microfilaria, which migrates to the bloodstream, and they are picked up by the mosquitoes when they feed on humans. Unlike onchocerciasis, in lymphatic filariasis, the adult stages and not the microfilaria are the responsible of the damage. In 2018, it was estimated that more than 51 million people are infected by lymphatic filariasis. These are images showing elephantiasis that normally affect lower limbs and genitals. Regarding lymphatic filariasis control, the global program to eliminate lymphatic filariasis was started in 1999, supported by WHO, World Bank, UNICEF, etc. And now this program is included in the Global Alliance to Eliminate Lymphatic Filariasis that is, of course, currently working. The same as in the case of onchocerciasis, in addition to the vector control, the core strategic intervention is preventing chemotherapy, mass drug administration, in this case with 3 different drugs, albendazole, diethyl carbamazine, and ivermectin, depending on the country, preventing the coendemicity with loiasis and onchocerciasis. In 2019, was calculated that 859 million people are living in endemic areas and require this mass drug administration, mainly in African and in Asian countries. As we can see here, South Korea is free from lymphatic filariasis, but in fact, South Korea was endemic for Brugia malaji, the first cases appearing in literature in the 1920s. And this is a picture of a female, a woman from South Korea affected by Brugia malaji in one of his legs. But fortunately, Brugia malaji was successfully eliminated from South Korea thanks to the mass drug administration with diethyl carbamazine. So then the pandemic appears. Okay, give me a sec. The pandemic appears. So let's have a look at the impact of this pandemic on the parasitic diseases, or in general, on the neglected tropical diseases. Okay, this is an interesting article that appeared in The Lancet last year. Let me read. On April the 1st, 2020, WHO issued a general recommendation postponing NTDs programs. The aftermath of WHO's recommendations on NTDs had notable negative impacts on the roadmaps towards the end of various NTDs, and several gains made over the years through the sparingly funded control programs have been lost. This is the most important impact. The large-scale treatment programs and other community-based services are particularly impacted. For example, in 2019, 1 billion people were treated, but in 2020, only 732 million. That means that 269 million fewer people were treated, this preventing chemotherapy, in 2020 than in 2019. So, in 2020, only 62 countries were implemented NTDs program, but in 2019, 83 countries. Preventive chemotherapy is intervention that has been most frequently disrupted. For example, this was the treatment and coverage in 2019, and this is the coverage in 2020. Concerning countries, this was the coverage in 2019, the 66% of the affected countries, but in 2020, only the coverage was 42% of the affected countries. So, particularly in the case of lymphatic filariasis, in 2019, 63% of the affected countries were treated, but in 2020, only 39.9%. And in the case of onchocerciasis, in 2019, were treated the 70.5% of the affected countries, but only 41.9% in 2020. Okay, now let's have a look at the case of guinea worm disease caused by Dracunculus medinensis. Dracunculiasis in 1986, when the campaign for eradication of dracunculiasis started, the number of cases were 3.5 million people, affected people from 21 countries. But in 2019, only 54 cases after the implementation of the dracunculiasis control program. And last year, in 2020, only 27 people affected, 27 cases in 6 countries, African countries, Chad, Ethiopia, Mali, South Sudan, Angola, and Cameroon. And in this year, until the end of August, only 10 cases. So, why apparently COVID-19 pandemic hasn't had any impact on the control of guinea worm disease? Because guinea worm cases fell 50% in 2020, despite the challenges of the COVID-19 pandemic. The number of human guinea worm cases was cut in half to just 27 in 2020. Well, to understand this, let's have a look at the life cycle of Dracunculus medinensis. This is also a two-host life cycle involving humans as well as dogs as a definitive host that become infected after the ingestion of contaminated water containing copepods, the intermediate host harboring the infective larvae. These larvae turn into subcutaneous adult stages around 1 year after becoming infected. We drink the contaminated water in June, for example, and then 1 year later, next year, the symptoms appear. Normally, females produce a burning blister, normally in lower limbs. Then fresh water alleviates this burning. And when humans or dogs enter into the water, thousands of L1 larvae, small larvae, are released from the ulcer. Copepods ingest these larvae that turns into infective ones inside the copepods. And it has been suggested that fish and frogs can act as paratenic or transport hosts in this life cycle, but this transmission route hasn't been proved yet. These are images of emerging females, and the inflammatory process causes fever, pain, suffering, even sometimes paralysis. For these neglected parasitic diseases, there is no pharmacological treatment, and the female must be extracted in a process that can last for days, weeks, or even a month. This is a curiosity. In this document, International Evaluation of Indian Guinea Worm Eradication Program, released in 1995, that Korea was classified inside the Group D of countries, those with sporadic indigenous cases, but no history of endemic disease, due to a case published twice in 1926 and 27, the same case, of Filaria medinensis in Korea. No more cases have never been reported in this country. Probably this was a case of misdiagnosis, probably mistaken or confused with gnatostomiasis. Therefore, if we analyze Dracunculus medinensis life cycle, we perfectly understand why COVID-19 pandemic has not affected guinea worm control. The successful guinea worm eradication program started in 1986. In this program, preventing chemotherapy is not a strategic intervention. It's off the table because it's not necessary for the disease, because the core strategic intervention is related to drink safe water, is related to drinking water. So preventing chemotherapy is not necessary, is not included in the control program of this disease. Therefore, in 2020, preventing chemotherapy intervention was the most frequently disrupted among all entities' services. This impact has been specifically analyzed in 7 entities, lymphatic filariasis and onchocerciasis among them. And different models have established the estimated delay in the 2030 targets. While it is not yet possible to assess the full impact of COVID-19 pandemic on the global control of human parasitic infections, the negative consequences will almost certainly be profound. And unfortunately, these likely consequences are going to be the increased entity burden, including parasitic diseases, of course, the delay in the achievement of public health goals, reduced collection, analysis, and sharing of data, and terribly prolonged suffering and neglect. The COVID-19 pandemic has turned the clock back by years in the fight against entities. Okay, that's all. Many thanks for your attention, and please keep safe. Bye-bye.
Thank you, Dr. Kallan Puchades. Actually, the time difference is very big between Korea and Spain. It is too much early in the morning. So she just sent a clip, the movie clip to us, and actually she's not available online. So we'll finish her presentation. Thank you very much anyway. And the next will be given by me. So I will continue. Okay. My topic title is COVID-19 and double neglected tropical diseases. I'm from International Parasite Resource Bank. As you know, the next we are in the era of corona pandemic. It affects in many ways parasitology also, and every part of global situation is affected by this corona. And first of all, I want next one. Next. Let me tell you that World Health Organization, it has WHO coronavirus dashboard, which informs up-to-date information every day. Next. So yesterday morning, 4:27 p.m., there have been the confirmed cases, the correct number of confirmed cases of COVID-19, and there is death information 5 million, and vaccine doses total population. So that kind of information is every day they are provided. Next. Sorry, just a moment. Thank you very much. All the different continent, they have correct number, correct data of pandemic confirmed cases, corona confirmed cases number given. So you can refer anytime when you want. Today, I'm going to bring up the important thing that people usually do not mention. That is, we have to take care of health workers. They are striving just in front of the corona pandemic. So we have to protect our health and health workers, healthcare workers. You see, many doctors and nurses, they work all day long, overloaded. Really, they are struggling against the pandemic. So we can understand their situation. And WHO provides the COVID-19 pandemic, the stages from 1 to stage 5. The stage 1 is unknown virus emerges, and stage 2, a pandemic unfolds, and the stage 3 pandemic accelerates, and stage 4 multifaceted pandemic, stage 5 medical countermeasures. So the stage 1, the unknown viruses emerges. Actually, it was from China, and brought a lot, and in stage 1, there was initial response to the virus. And there were researches for diagnostics, vaccines, and therapeutics began immediately, but still no concrete action was initiated. In stage 2, a pandemic unfolds. By March 2020, there were over 120,000 cases, and already there was more than 4,600 deaths already, and European countries and Asian countries show heavier than other areas. COVID-19 spread outside of China, and The first contact country was Korea, was also one of those countries, and Iran and Italy showed very early outbreak of this COVID virus. And there were four scenarios for COVID-19 response. The first scenario, no reported cases, that was possible, and sporadic cases and cluster of cases, community transmission. The scenario 4, that is most serious situation. And in many countries, the COVID-19 spread and it led the community transmission. More and more people were infected with this virus. There were implementation of public health and social measures. So bigger and bigger situation appeared. And health systems were under pressure. Even wealthy countries, not only the poor countries, even wealthy countries, they had pressure. In stage 3, the pandemic accelerates. The epicenter moved from Europe to Americas, and more than 200 countries were involved, and so many deaths, 500,000 deaths by that phase. And beyond the health crisis, impact spread on all of the society. So panic, kind of panic started. In stage 3, the African region were also affected by this viral disease. And it spreads more easily in certain settings, like when we gather in great number, like when we to see some kind of movies, some sports game, that kind of situation, special situation, it made more easy in spreading. Singing is one of the example, and exercising, shouting, that kind of situation is more dangerous. And the stage 4, the multi-faceted pandemic, and much bigger number of pandemic confirmed cases were reported, and every day it continued. And in stage 4, global partnership were set, and great amount of money were provided to do this stage control of pandemic. And in stage 4, the global solidarity reached, and WHO initiated and developed some kinds of vaccine and treatment. And the Director General announced that no one is safe until everyone is safe. In stage 4, the infodemic a lot of information, just like tsunami of information. Some are accurate, but some are not very accurate. Anyway, all of the information spreads alongside an epidemic or pandemic. So we call that infodemic, information pandemic. And in stage 5, medical countermeasures available. So vaccines and the treatment is developed and under examination. And in stage 5, COVID-19 vaccine accelerated development. And a lot of million vaccine doses have been administered. This shows the Israel, UAE, UK, Bahrain, they were shot with the vaccine. The time was February 28, so now it is more increased. And there are many vaccine candidates, and among them 4 candidate vaccines it is in phase of use. One of them is Pfizer, and also Moderna, AstraZeneca, Sinovac. These vaccines were used. And in stage 5, new emerging SARS-CoV-2 variants, we noticed that we knew another kind of SARS-CoV-2. So we call that alpha, beta, gamma, delta. Anyway, economic impacts of pandemic. And one important thing that I have to say that in stage 5, extreme poverty is predicted to increase sharply. Actually, the poor people are neglected economically or geographically, and the corona pandemic situation much accelerated the poverty. So extreme poverty was seen. That was worst scenario, and it could be 115 million people were in the middle of extreme poverty. So that was a kind of tragedy. And this shows the variants alpha, beta, gamma, delta, and shows the locality of these variants. Here is Bangladesh. It has alpha, beta variants and delta, but gamma variants not confirmed. Yeah? And there is information of Republic of Korea. Okay, we have the Korea. Mm. And I'm going to show you the current status of corona pandemic in Republic of Korea. Currently, 3,187 deaths. And as of 6 November 2021, total, this number of people were vaccinated. This is the day-by-day information of occurrence confirmed cases in Korea. Now, daily more than 3,000 cases were confirmed. This shows the imported cases from which country? From China, from Europe, America, Africa, kind of information. And this shows the number of confirmed cases by gender. Between male and female, there's not much difference, almost same. And this table shows the number of confirmed cases by age group, more than over 80 years old or older. The number of deaths shows top. Almost half of all confirmed cases, and the younger age, between 10 to 19, there's no death at all. This figure shows the COVID-19 shock made economy crisis. The problem of COVID-19, it uses all the money in combating with COVID virus. So many other diseases, just like neglected tropical diseases, most of the activity to control these neglected tropical diseases was stopped or seized or minimized in activity. Still, we have so many parasitic diseases. There are many, but the COVID-19 urged it to stop. There's another kind of disease, or parasitic disease. We have so many, but most of them are ceased. The problem is still there are many countries and people who needs support of help for healthcare, but it is almost stopped. That is a big problem. So what I want to bring up is a problem of neglected tropical disease. The definition of neglected tropical disease is the disease neglected economically or geographically. So economically, because they are poor and they have no cash or money, so they cannot afford the medicine. That is a problem. And geographically, they don't have enough facilities nearby. So moving to hospital very far. So that is also neglected people. So definitely, I can say that neglected tropical disease become double neglected tropical disease due to the COVID-19 pandemic. That is the serious that we need to consider about. Thank you very much. If anybody online, if you have any question.
Hello.
Yes. Dr. Singla.
Thank you so much
Oh, yeah. Good morning.
to Professor Thomas Om.
Yeah.
Indeed, an excellent presentation, sir,
Thank you.
on COVID-19 and double neglected tropical diseases. You yourself discussed 5 stages of COVID-19 virus. Stage 1, followed by stage 2, pandemic unfolds. The pandemic accelerates. Then the 4th stage, multifaceted pandemic. Stage 5, medical countermeasures available. Then you discussed something like that. You really, in your presentation, already neglected tropical diseases.
Dr.
They become
Singla.
double neglected
Dr.
due to
Singla.
COVID-19.
Dr. Singla. Could
Hello?
you raise up your voice?
My voice is not there.
Mm-hmm.
Hello?
Hello, Dr. Singla. Was
Hello?
it your question?
My question is, what do you think about the impact of transfer of knowledge due to pandemic 19 as far as parasitic diseases is concerned? What about the impact of pandemic 19 on transfer of knowledge, just like symposia or some other methods of transfer of knowledge, impact of COVID-19 on transfer of knowledge? Number 1. Number 2, any impact of COVID-19 on parasitic research work? I'm sorry.
Professor Laxman Shingla, good morning.
Good morning. Good morning.
Good morning. Nice to see you today in our symposium. Yesterday also, I'm very happy to see you. So thank you
Thank
for
you so
joining.
much, Dr. Taylor.
Yeah, thank you for joining with us. Actually, we have some problem. We cannot hear your voice clearly. So I would like to request you. Can you please write your question and send to me? Then I will give it to Professor Om. Then Professor Om will
Definitely,
discuss.
Dr.
Yeah.
Taylor. Definitely, I will write the question and will send to you.
Yes, thank you so much. And now we have.
Thank you very much for the nice presentation by Dr. Om.
And Professor Laxman Shingla, now we have one scientific session, and this session will also chaired by Professor Kesones Om. So after the session, we have time for discussion of all of this plenary session and the scientific session also. Uh, Distinguished guests and audience, thank you for joining our first plenary session of the day. And there was two very important lecture from the two world-recognized scientists, and we are very happy to get this kind of scientist in the second International Parasite Resource Bank Symposium 2021. Now, we are going to continue our first scientific session of day 2, and this scientific session is titled by COVID-19 Crisis and Parasite Resource. And we are going to continue this session by chair with Professor Kesones Om. I would like to request Professor Kesones Om to continue our first scientific session of the day. Professor Kesones Om.
Thank you very much. This is the session 3. We also have two speakers. The first one is Dr. Muhammad Shafiul Alam from ICDDRB Bangladesh, and he is going to give a speech with the title of impact of COVID-19 in service delivery for parasitic and vector-borne diseases. Dr. Shafiul is a renowned parasitologist in ICDDRB in Bangladesh. So please, we welcome you, Dr. Shafiul.
Hello, my name is Mohammad Shafiul Alam. I'm working as a scientist at the Emerging Infections and Parasitology Laboratory of ICDDRB Bangladesh. I'll be talking about impact of COVID-19 in service delivery for parasitic and vector-borne diseases. As we all know that COVID-19 was first reported in Wuhan, China in late December 2019. But after that, 224 countries and territories of the world have been affected. More than 253 million people infected, and of them 5.1 million people died due to this disease. In the global distribution, here in this map, you can see in the most dense cyan zones where they have more than 10,000 people infected out of 100,000 people, and most of these zones are in the United States, Brazil, and some part in Europe. However, in looking into this pie chart, we can see that 6 countries, United States of America, India, Brazil, United Kingdom, Russia, and Turkey, represented more than 50% of the COVID-19 cases globally. In case of Bangladesh, the COVID-19 was first reported in March 2020. Until then, we reported more than 150,000 cases, and of them, about 28,000 people died. The case fatality rate was 1.8%, and the recovery rate was 97.7%. Out of the administrative zone, we can see the Dhaka division reported about 60% of the total cases. However, the disease was spread across the country. Rationale, the health system worldwide was not ready for this huge burden imposed by the COVID-19 pandemic, and thus suffered from lack of resources within their existing setup. Many symptoms of COVID-19 include fever, headache, malaria, and common cold, etc. Often it's difficult to distinguish, as some of these parasitic and vector-borne diseases like malaria, dengue, chikungunya also have these overlapping symptoms. In co-endemic areas, there is a chance to misdiagnosis. The outcome could end in a prolonged morbidity and even fatal. Now talk about some internal problems like dengue. Dengue was first reported in 2000 in Bangladesh, and till then it's become endemic. And in 2009, we have a big outbreak in the country where more than 100,000 people infected and 179 died. But I tell you, this number is actual number more than that, because this number is actually representing only some hospital where the surveillance system is existed. After that, 2020, we had very less number, which actually may be due to this COVID, because I say COVID came in our country in March, and the big season of dengue is actually from June to August. So that actually it means due to this COVID, the essential services were compromised. Then people were afraid to go to the hospital to report the dengue status. So now this year, Bangladesh is actually fighting, for the outbreak of again in dengue and COVID. So here I try to plot both dengue and COVID incidents. Here you can see from January 20 to November 2021. Here we can see there is major ups and downs for COVID. We have different peak in our country for COVID, and here in this time we have greater number of dengue, which means that dengue people are now reporting, which was they were afraid maybe in 2020. And also there have been reports of co-infection. The first co-infection of dengue and COVID was reported in May 2020 when a 53-year-old male reported to have both COVID-19 and dengue. Since then, there were many cases of co-infection, and there are several deaths due to COVID and dengue co-infection in Bangladesh. Similar situation also prevailed for malaria. Historically, Bangladesh is a malaria endemic country, although malaria is endemic in 13 out of 64 districts of Bangladesh. And you can also see after 2029, the number suddenly dropped. And this is probably due to COVID-19. In 2020, we reported 6,130 malaria cases, but till October 2021, these numbers reported is 6,381. That's mean, case number is increasing. It means the situation is improving for health services. Many countries reported malaria and COVID-19 co-infection. This is not only the Bangladesh. Most of the co-infections were reported in Nigeria and then India. And there are other countries where they reported, but the number was like single digits. This is more reported for Vivax malaria than Falciparum. There are 5 human malaria parasites, but as Vivax is more chronic and is reported to have more co-infection in case of Vivax. And however, deaths were associated with severe malaria falciparum co-infection with COVID-19. We look back to one of our malaria endemic area in Chittagong Hill Tracts, and we found in the population that they have about 20% of the people are reactive to COVID-19. That means they have developed COVID-19 antibodies. But in the reality, the number of reported cases were very low. Bangladesh also reported 1 COVID-19 and malaria co-infection deaths in Chittagong Hill Tracts. A pregnant woman died due to the complications of COVID-19 and severe malaria in Chittagong Hospital a few months back. Thus, many essential health services were somewhat interrupted due to COVID-19 pandemic. In the community level, as resources were diverted to COVID-19, which actually affected services to the communicable diseases program. People suffered but scared to report to the tertiary healthcare facilities. Limited services were offered by the health facilities during peak COVID-19 transmission period. Here, the essential service includes antenatal checkup, postnatal care, EPI program, family planning, etc. Thus, we need an integrated mechanism to fight against this kind of emerging diseases in future so that we can overcome this sudden pandemic condition in future. I would like to thank the organizing committee for inviting me to speak, and also I would like to thank our co-donors who are supporting to ICTIB. Thank you, everyone.
Thank you, Dr. Shafiul. That's very interesting report. Very interesting that the COVID-19 and malaria, the resistance to COVID-19 may be possible. Actually, that reminds me that in Korea, we have new drug for anti-malaria, and the company is producing the malaria drug, and quite very recently, the company officer is thinking that the anti-malarial drug from Korean Shinpong company may be used for COVID-19. What do you think about that kind of very strange and interesting information?
Yeah, it's possible. Thank you, TM. Yeah, it's possible. I have seen that one data that we are doing one survey in malaria endemic area. So basically, our intention is to look on the baseline antibody level for both COVID and malaria. So we'll also test malaria antibody. That is sample is already in our lab and we'll be testing. So our intention was to trial ivermectin, because you already know in globally ivermectin is being used for COVID-19 testing. So we are thinking for ivermectin as a prophylactic for malaria also. So the next step, we are planning to enroll ivermectin in the field, as a prophylactic for both malaria and COVID-19. So it's totally possible. And if your Korean company is interested, we can also help them for the field trials, as we have the field setup in high remote areas. And also, for ivermectin, it is also zooprophylactic. If you can put the line on the animals like cattle, it also protect from mosquitoes, which means if the mosquito is reduced due to this lining, and also malaria will reduce. So that would be a multi-arm study. So at this moment, US FIMS is collaborating us for this pilot study, and hopefully next year, once we have all the data, we look for field trial. But we can also look for other drugs. It's possible. Thank you.
Yeah, that's also very interesting about the ivermectin information. And those effects was seen in Chittagong only.
Yes, because the Chittagong is most, like 95% of malaria cases are there. Was there, and even for the first dengue death also came from Chittagong. So because in Chittagong metropolitan area is also highly endemic for dengue. That area came for Chittagong because still there are natural forests exist in Chittagong hill tracts, and also natural breeding places for Anopheles. You don't get any Anopheles in Dhaka, but you can get in Chittagong. So that's why Chittagong has the suitable environment for surviving malaria parasites, and that also, the reason why we are getting cases there.
Thank you. Yeah, very interesting. Is there any more question for Dr. Shafiul. Welcome any question. If there is no more question, thank you very much, Dr. Shafiul. Possibly next week we will see you.
Yeah. Yeah,
So-
yeah. I'm also looking forward to
Yeah,
see you.
let's see you again next
luck.
week.
Thank you.
very much
Dr.
for today. Your topic was very interesting, and thank you for your excellent speech. Thank you very much. Bye bye.
Bye-bye.
And we'll move to the next topic that will be presented by Dr. Singla in India, the veterinary parasitology Guru Angad Veterinary and Animal Science University, Ludhiana, India. Welcome you, Dr. Singla, again. Some time ago, you were invited to Parasite Talk, and today, I'm welcoming you again. Thank you very much. Please, Dr. Singla, with the title of New Place of Parasitic Diseases in the COVID-19 pandemic, whether threat factor or shielding agent. The title is correct. Whether threat factor or shielding agent. Sorry, the booklet a little misspelled. The correct title is whether threat factor or shielding agent. Please, Dr. Singla, we are waiting for your speech.
To all the participants of Second International Parasite Resource Bank Symposium, to my presentation, New State of Affairs of Parasitic Diseases in the COVID-19 pandemic, whether threat factors or shielding agents. I am Dr. L.D. Singla, Professor Veterinary Parasitology, Director Human Resource Management Center, Guru Angad Dev Veterinary and Animal Science University, Ludhiana, Punjab, India. As we all know that COVID-19 caused by severe acute respiratory syndrome coronavirus 2, that is SARS-CoV-2, is an infectious agent which is responsible for causing current pandemic. After the identification of this virus caused by SARS-CoV-2 in Wuhan city on 17th November 2019, the infectious agent spread at a faster speed and was recognized as pandemic on 11th March 2020. Since then, this particular disease has continued unabated and with considerable efforts in public health, lifestyle and global economy. The parasites may direct the course of COVID-19 infection either as risk factor or defending agent. So, in this presentation, I will highlight the similarities between the symptoms caused by human parasitosis and those of COVID-19, then impact of this particular virus on parasitic disease and potential influence of parasites on SARS-CoV-2 virus pathogenesis and discuss their mutual influence. This particular infection, COVID-19, is characterized by fever with cough and dyspnea. It can be easily mistaken with other respiratory system diseases and most commonly influenza. Interestingly, similar symptoms have also been observed in a number of parasitosis or parasites or parasitic diseases. Not only can parasite infections influence the immune system as the immunopotentiators or immunosuppressant, they can destroy the tissue, cause anemia and malnutrition. We all know about that. They can also be potentially support the viral infection and can affect the effectiveness of vaccines. However, as far as the parasites is concerned, the immunomodulation caused by parasites may protect for tissue damage caused by the virus by reducing the inflammatory processes. Thus, parasites may act as risk factors or protective agent in COVID-19 pandemic, which we want to discuss today. Parasites may act as increasing risk factor for the infection, but at the same time, they may act as a protective agent also. They assist each other also. But at the same time, due to similarity between the symptoms of parasites as well as the COVID-19, there may be lead to misdiagnosis of the infection. Some of the parasites, they are responsible for causing pulmonary system symptoms, just like dry cough, dyspnea, wheezing, and Loeffler syndrome. They may belong to protozoa, just like Entamoeba histolytica or Plasmodium species, when they are found in pulmonary type of symptoms. Helminths also. So, as enlisted in this table, however, we will discuss in the next few slides one by one. Some of the parasites, they remain misdiagnosed during COVID-19 because of similarities between the signs and symptoms of COVID-19 to that of parasites. Here is a list of protozoa as you see here, but at the same time, two trematodes which are found in the lungs, Schistosoma and Paragonimus, sometimes the cystic stages, cystic echinococcus, as far as cestodes is concerned, take a route of migration caused by some of the nematode parasites, which are responsible for symptoms and signs of lung disease similar to that of COVID-19, leading to misdiagnosis. Two very important protozoan parasites, that is Naegleria fowleri and Acanthamoeba castellini infections. In these two infections, there is a reporting of loss of smell and taste, which are very characteristic features in COVID-19 infection. Basically, how it occurs? Why it is there? The symptoms of taste, loss of smell and taste. The parasite basically they enter the central nervous system, especially Naegleria fowleri, move to the brain through the olfactory nerve and begins to destroy the nervous tissue. Naegleria infection cause hemorrhagic necrosis of the brain, resulting into pulmonary amoebic meningoencephalitis. The secretions of cytokines and exogenous endotoxins are very important. These cause headaches and damage to the olfactory nerve, resulting into the loss of smell or loss of sensation of smell. Then this parasite, that is Acanthamoeba castellini, it is responsible for causing granulomatous amoebic encephalitis. The symptoms of the disease caused by Acanthamoeba are also similar to Naegleria infection, leading to headache, fever, disturbances of taste, smell, vision, hemiplegia, and damage to the cranial nerves and ataxia. So symptoms mimicking to COVID-19 are seen in these infections. Another important and widespread, highly significant disease affecting humans is malaria. According to WHO, in 2019, there were 229 million cases of malaria, resulting into 4,99,000 deaths. In comparison, if we think of the COVID-19, on 26th February 2021, the number of COVID-19 cases were about half that of malaria, that is 113 million. However, death number was more. It was 2.5 million deaths. One of the most serious concerns of malaria is pulmonary malaria. It should be differentiated from COVID-19, especially in the endemic areas. Why? Because the infection can lead to severe anemia, which adversely affects the course of COVID-19 comorbidities and hence result in poor survival. But at the same time, we will discuss that somewhere when chronic infections of malaria are there, it will be beneficial too. On the contrary, because of the stopping of preventive programs, malaria has been predicted to increase. The COVID-19 pandemic, which may result in 36% more malaria deaths over the next 5 years compared with the pre-pandemic situation. Similar to malaria, there is another disease, Babesia, which has got similar symptoms to that of COVID-19, which may result in one disease being misdiagnosed with the other, or the possibility of co-infection, which can be missed, which is important. Human respiratory system can be infected with flukes as well. Schistosoma, that is blood fluke, Paragonimus, lung fluke, demonstrate very similar symptoms to that of COVID-19. A study of 60 schistosome infections patients found that 8 have pulmonary symptoms, with another 8 reporting cough, shortness of breath, lymphadenopathy, nausea and vomiting. Some reported nocturnal fever also. Pulmonary paragoniosis in 76 to 90% cases show symptoms including coughing, rusty brown or brown bloodstain, sputum, recurrent hemoptysis, resulting in potential misdiagnosis with tuberculosis because symptoms are similar to that of tuberculosis in case of paragoniosis. In some of the cystic echinococcus cases, the symptoms similar to COVID-19 can be seen. Mainly in cystic echinococcus, most of the cases are found in the liver, but in 20% cases, lung infection can also be seen. Clinical pulmonary symptoms include coughing with clear sputum, dyspnea, and chest pain and fever. In 72% cases, in pulmonary cystic echinococcus, cysts appear only in one lobe. Presence of pulmonary echinococcus is often not apparent on X-ray. However, this can be seen by CT scan. Though the symptoms are similar to cystic echinococcus as well as COVID-19, just like when the cyst ruptures, more severe symptoms are seen: asthma-like symptoms, respiratory distress, persistent pneumonia, anaphylactic shock, sepsis, and elevation of serum IgG and eosinophilia. This is eosinophilia that can differentiate cystic echinococcus from that of COVID-19. Then I was discussing regarding tracheal route of migration, especially in Ascaris and hookworms. Patients in tracheal route of migration, they experience cough, fever, breathlessness, rapid breathing, chills, paleness, and muscle pain. Why it is so? Because the parasites L3 to L4 stage, they penetrate in the lung tissues, leading to such symptoms. Especially common symptoms is Lafleur syndrome, a self-limiting disease associated with lung inflammation and pulmonary eosinophilia. Hyper-eosinophilia is the major feature of ascariasis that discriminates it from the COVID-19 associated leukopenia. Similar to this, in case of hookworms or human hookworms infection associated with migration of a kind of Concylostoma duodenale or Nectarium americanus larvae can be confused with COVID-19. Parasites in the small intestine, when they go back and feed on blood, they cause potential protein deficiency, especially in hookworm infection, and iron deficiency in anemia, which may result into rapid or easier incursion or invasion of other infections such as COVID-19. This is how the hookworms, especially, they are dangerous in COVID-19. This slide is very important. Corticosteroids and tocilizumab treatment in COVID-19 facilitates strongyloides. Very important. Physicians should be aware that corticosteroids and tocilizumab treatment can facilitate this infection, strongyloides, resulting into hyperinfections and dissemination of infections and leading to death. At least 2 cases of subsequent strongyloides infection have been recorded in patients with COVID-19. One was from Italian woman after treatment with dexamethasone and tocilizumab, and another case in 60-year-old man who demonstrated disseminated infection due to strongyloides after tocilizumab and methylprednisolone treatment. What should be done in such cases so that severity of infection and death should not be there? In highly exposed regions, the individuals with COVID-19 should be screened for strongyloides infection before treatment with these corticosteroids or tocilizumab. One possible solution. Another possible solution is for risk patients, a combination of serological testing and use of ivermectin therapy before going for such treatments of corticosteroids in COVID-19 patients. Parasitic infections or co-infections with COVID-19 can be either beneficial or detrimental to COVID-19 severity. Goodman and colleagues 2020 predicted that co-infection with parasitic diseases such as malaria may provoke complication with SARS-CoV-2 or COVID-19. But at the same time, Sometimes we see the common malaria may be beneficial when chronic infection. How it is, we will discuss in some of the slides, but at the same time, today, how COVID-19 is dangerous. It is by two ways. One is by cytokine storm, second is by bradykinin storm. COVID-19 often results in organ damage caused by overreaction of immune system, that is cytokine storm, resulting in production of a number of immune cells which may attack the healthy tissue of the lungs and other organs. In addition to this cytokine storm, pathogenesis of COVID-19 believed to include so-called bradykinin storm, resulting into many symptoms associated with COVID-19 infection, ranging from loss of smell, sense, or taste, and abnormal coagulation. Chronic helminth infections, they shift the immune system towards type 2 immunity because in COVID-19, Th1 type of immune response is there. Characterized by production of interleukin IL-4, 5, 9, or 13. Thus, helminth co-infection may increase the morbidity and mortality of COVID-19 because the immune system cannot efficiently respond to the virus. But at the same time, when highly damage is occurring to the lungs or other organs because of inflammatory regions, it may be beneficial too. This slide shows how the soil-transmitted helminths can be useful in COVID-19 infection. SARS-CoV-19 infects the host cells through angiotensin converting enzyme ACE2 receptors, which are elevated in inflammatory conditions. COVID-19 infection triggers Th1 response, which produces pro-inflammatory cytokines. When overproduced, the Th1 cytokines, they trigger the hyperinflammatory Th17 response. These responses inhibit the T regulatory cell differentiation, which is needed to suppress the inflammatory cytokines. A cytokine storm occurs. This storm is responsible for acute respiratory distress syndrome, which is responsible for tissue damage, lung damage. Th2 response of soil-transmitted helminths suppress the inflammation through the production of anti-inflammatory and regulatory cytokines, as well as balancing Th1 response pathway through the production of CD4 positive T cells and T regulatory cells. Th17 response is less likely to induce and cytokine storm should not occur. Soil-transmitted helminths are associated with the reduction of this inflammatory comorbidities, further reducing the likelihood of cytokine storm, which is occurring, and with the reduction of inflammatory comorbidities. This will further decrease the ACTE2 receptors, leading to reduction in the infection, hence reduction in viral load, inflammatory immune system, and symptoms. Thus, Th2 response is highly beneficial in COVID-19 infection, when especially in the chronic form. Parasitic infections can lead to increased susceptibility to other infections and decreased vaccination efficacy. Vaccines will be less effective for these patients, but treatment and prevention of helminth infections might reduce the negative effect of COVID-19. Chronic helminth infections found to stimulate type 2 immunity. We all know about that response, leading to suppression of immune system against the intracellular pathogens, in which the type 1 type of immunity is there. Suppression was found to infest the increased susceptibility to infections, diseases such as HIV, AIDS, or tuberculosis. Hence, SARS-CoV-2 and helminth co-infections can lead to more severe outcome, especially in population with either HIV, AIDS patient, or malaria patient, or tuberculosis. COVID-19 pandemic has greatly impacted the anti-parasitic prevention programs and parasitic diagnosis. As on April 1st, 2020, the World Health Organization issued general recommendations to interrupt all the activities for control of neglected tropical diseases, including parasitic ones. Despite high number of human cases of parasites, as you see here, estimated number of cases of selected parasitic diseases per minute, very high. COVID-19 can greatly impacted malaria prevention program and incidence. Most of the African countries, especially those with malaria is endemic, demonstrate significantly lower COVID-19 incidence and mortality compared to North Africa, Western Europe, and World Health Organization predicts that pandemic-driven shortfall in prevention and treatment efforts will occur in sub-Saharan Africa and that this will result in a higher number of malaria deaths, mostly among the children. As COVID-19 pandemic threatens malaria prevention activities such as distribution of insecticide-treated nets, indoor residual spraying, and malaria chemoprevention, which are required for constant to avoid malaria outbreaks. A 10% disruption in malaria program could lead to 19,000 additional malaria deaths in a year, and a more possible disruption of 25 to 50% are predicted to result in further 46,000 to 1 lakh cases. Shard Smith and colleagues 2020 warned that the COVID-19 pandemic could result in an extra 206 million malaria cases and 3,79,000 deaths in sub-Saharan Africa. COVID-19 have set the fight against parasite back by at least a decade. This is due to the implementation of lockdowns and restricting the movement of healthcare workers. Restoring the programs to prevent, treat and control of helminths could well reduce the incidence of mortality due to COVID-19 in endemic areas and help to increase the vaccination effectiveness. COVID-19 pandemic has also had considerable effect on parasitic diagnostics, as many laboratories are now required to perform COVID-19 tests. They have had to suspend or reduce their typical parasitological testing duties, which has had a significant impact on the number of diagnosed cases of human parasitosis. Decrease in the number of ordered or performed parasitological diagnostic tests is noticeable in many of the laboratories. However, we don't yet have accurate and reliable data on this matter. Can parasitic infections, they protect us from COVID-19? Helminth infections basically entail various forms of immunomodulators or immunomodulation, resulting in increased susceptibility to some infections and decreased susceptibility to others, and change in especially the intensity of allergy or allergic reactions, autoimmune and inflammatory diseases. Infection may account for inadequate response to vaccines and possibly better tolerance to SARS-CoV-2 infection or COVID-19 infection. Lower number of COVID-19 cases in the areas where malaria is endemic or schistosomiasis is endemic or soil-transmitted helminth infections are endemic has been reported. This could suggest that there is possible protective effect of COVID-19 infection. Interestingly, the helminth infections, especially if we think of Fasciola hepatica, have been found to demonstrate immunomodulatory properties, and several Fasciola products have been described as potent immunomodulators. An inverse relationship has been reported between the number of cases of certain neglected tropical parasitic diseases and those of COVID-19, with one study suggesting that malaria may offer protective effect against COVID-19. The patient with COVID-19 and Bucradia bancrofti co-infection, T-cell hyperactivation may cause relatively milder course of COVID-19. Lower lethality of COVID-19 in sub-Saharan Africa may also be related with inhibition of inflammatory processes by immunomodulatory molecules being released by the helminth infections. Malaria patients develop anti-GPI antibodies that can identify COVID-19 glycoproteins that could consequently play a protective role against COVID-19 and ameliorate the effect of this particular disease. In regions where malaria is endemic, hydrochloroquine or chloroquine prophylaxis may have preventive or curative effect against COVID-19. Impact of parasite-driven microbiome diversity and composition of COVID-19 severity. Certain protozoa such as commensal entamoeba, Cryptosporidium species and helminths reach the gut with so-called beneficial microbiome profile with dominant Th2 response and T regulatory pre-existing condition might mute hyperactive immune response upon infection with COVID-19. In this milieu, SARS-CoV-19 replication is controlled here, leading to healthy alveolar in asymptomatic or mild COVID-19 infection. There is another possibility that Th2 type anti-regulatory responses might suppress anti-SARS-CoV virus immunity, thereby hastening the COVID-19 severity. On the contrary, when there is gut dysbiosis, it may result in some pathogenic proteoa such as Entamoeba histolytica or helminths, or patients without parasite co-infection with underlying pre-existing Th1 type of response. Immune response might facilitate cytokine storm and aggravate COVID-19 severity. In patients with such gut dysbiosis, COVID-19 replication is significantly increased, leading to injured alveolar severe COVID-19 infection. Parasites or its molecule can influence the entry of COVID-19 into the lung cells and affect the hyperinflammation reaction in the lungs. In vivo as well as in vitro models have been made to study the parasite influence on viral infection in greater details. Coming on to the conclusions, due to COVID-19 novelty, it is often misdiagnosed as other parasitic infections or diseases infecting the pulmonary system. Due to its scale, current coronavirus pandemic may affect the diagnosis, prevention, and elimination program of parasitic diseases. Research indicates that helminth co-infections can have a synergistic or antagonistic effect on the course of COVID-19. However, using the current state of knowledge and small number of described co-infections, it is difficult to clearly define the influence of parasitic infections of COVID-19. The parasites, they may manipulate the course of COVID-19 infection either as a risk factor or protective agents. Restoring program to prevent, treat and control of neglected tropical parasitic diseases, particularly those associated with helminths, could reduce the incidence and mortality of COVID-19 in endemic areas and help to increase the effectiveness of vaccines. It is suggested that the recovery from parasitic diseases can enhance the immune system and protect the COVID-19 infection. There is a great practical need for further studies examining the similarities in the disease symptoms as well as the risk factors and the possible role of parasites in the COVID-19 pandemic. The effect of immunosuppressive therapies must be monitored as their use may allow some parasites to find favorable conditions for uncontrolled proliferation, as we have seen Strongyloides infection. In the end, I will say that immunomodulatory responses elicited by the parasitic infections, especially chronic schistosomiasis, soil-transmitted helminthiasis, malaria, potentially decrease pro-inflammatory responses to SARS-CoV-2, resulting in asymptomatic or mild clinical COVID-19 presentation. Thank you so much. Welcome to all the participants of Second International Parasite Resource Bank Symposium. To my presentation, new state.
Thank you, Dr. Singla. It was very interesting, quite impressive. And now it's open to discussion. So if there is any question, please. Dr. Singla. Because we have many kinds of parasites, misdiagnosis is much, very possible because the COVID-19 major symptom is pulmonary symptoms like COVID-19, and we have many parasites sharing the common symptoms of pulmonary symptoms. In pulmonary disease like trematode, lung fluke, that kind of disease. So it's quite interesting. And among them, the Naegleria fowleri and Tameba, they share the symptoms of loss of smell and taste. That through my interesting. Is it? I'm asking you because I do not know very well.
Okay.
The loss of smell and taste, is it very common in Naegleria and amoeba disease?
Yes, yes, a loss of smell as well as loss of taste is there in both Naegleria as well as the amoeba. But at the same time, because these parasites, they travel to olfactory nerve. When there is damage of olfactory nerve, they lead symptoms similar to that of COVID-19, which are very true when there is storm of cytokines and there are exotoxins released in case of COVID-19. So similar symptoms are there in Naegleria as well as amoeba to COVID-19, Professor Om.
Yeah, thank you very much. I didn't know very well. Thank you. Dr. Tilak, you have question.
Thank you, Professor Om. Actually, I have two questions. One for Dr. Shafiul Alam sir. Dr. Shafiul Alam sir is in online.
Yes.
Yeah.
First of all, I would like to my sincere thanks to Dr. Shafiul Alam sir. Actually, Dr. Shafiul Alam sir is my master supervisor also, so I am his student. So this is a good chance for me to say something about today's presentation also. Today, actually, this is one of my favorite topic, vector-borne disease, and Shafiul Alam sir try to discuss relationship between this in the COVID pandemic time. Sir, I have one thing request. It's not question. Last July, I attended a course in University of Idaho, USA regarding vector-borne diseases. But as far I know, in Bangladesh, outside of the university regular course, there are no training or there are no extension course to regarding vector-borne diseases or vector-borne, how to control the vector-borne problems. And also ICDDRB is the leading research organization in Bangladesh, and they sometimes do some research, and you are the one of the leading researcher in this field. My question is that, do you have any plan to arrange or extension of training program to train the root level researcher or root level student or scientist, whatever you say, to teach about how we can handle the vector-borne diseases? And another thing is that in Bangladesh, actually, we don't have any regular checklist, what kind of vector we have or what kind of vector-borne disease is actually important for us. Do you have any kind of plan to make this kind of checklist or checklist for the vector as well as for the vector-borne diseases?
Thank you, Tilak. So the first thing is like, yes, we do have plan, but the problem is you also need, resources like manpower and also funds. So it's we arrange some trainings like for government peoples. Like when we had a project with USCDC, we arranged a training workshop for the government entomologists to train about how to use insecticide. CDC bottle bioassay. So we arranged that kind of workshop there. And also for students, probably remember we had one course in Mymensingh where probably Saiful or some other students attended. So that was through from one of my colleague, Dr. Dinesh Mandel, who did with with tropical medicine. But these are sporadic, but there is no scheduled training. And we, from ICRB, every we take 1 or 2 students and we train. But to train a bunch of students or like from different institutes, sometimes difficult if you don't have any regular programs. Because as ICT, we are mostly research oriented organization. We are not academic institute, so it should be come from like maybe in Dhaka University or your university or the iprb. If they have some kind of regular program, then maybe we can facilitate, or we can employ our resources there. So this is one question in response to one question. And the second one about uh, uh, what was your second question, Tilak?
To make a checklist of
Yes. Checklist. Yes, we already if you look on literature, we already have a checklist for mosquitoes for in Bangladesh, but for parasites, we actually don't have. In last year, we talked about this, and when there was a talk of Dr. Hamida Khanum in the first session in the iPRB, regular, then it was also discussed. So for that, maybe iPRB can help, because we have publications in national journals, and also in the master's thesis, but some of them, actually, it's not correctly diagnosed the species. So maybe we need a commission who can look on those and can identify which are the actually, correctly identified, and maybe we can make a checklist. But again, for that, we also need, some resources. So if we can arrange that, and we are willing to support, and then maybe when you are back in Dhaka, next week, I heard this, maybe we can also discuss in detail about this. Thank you.
Thank you, sir, for your nice information. Actually, I also have a very important discussion with you. Actually, University of Idaho, they are very interested to do some extension training in Bangladesh also, but they are looking for some active collaborator who can deal this kind of training. So maybe I will discuss with you during my next field trip with Professor Om, and iPRB maybe will also be collaborator of this kind of training. By the way, thank you, sir, for your nice presentation and your work. It's always very interesting and awesome for us. Thank you, sir.
Thank you, Tilak. Bye.
Thank you, Dr. Shafiul, for your kind answer.
Sir, I have one more question for Professor Singla.
Hello.
Professor, thank you very much for your nice presentation. This is really...
Thank you, Dr. Tilak, for giving me this opportunity. And thanks also to Professor Om.
Thank you, sir. Actually, it was very informative. And I have one thing to know, because the situation of India and situation of my country, Bangladesh, is not very different. Actually, we call Bangladesh also a country of Indian subcontinent. So that's why my question is that, what is the influence of COVID-19 in the research finding of the parasitology? Do you think that now, due to the COVID-19, the funding and the interest of research in parasitology in India is decreased?
Definitely, not only parasitology, but all infectious diseases. There are many funding agencies, Department of Science and Technology, Department of Biotechnology, and many more. Funding has been diverted towards COVID-19 prevention rather than these neglected diseases, especially the parasitic diseases. Because of chronic nature of these parasitic diseases, people think even government policies are like that. Only when surplus funding was there, it was being used. But due to COVID-19, maximum funding has been diverted towards the COVID side, or especially the viral infections. So now, as far as parasitic diseases is concerned, little funding is there, especially for orientation of some programs or for some such funding. It has been reduced. That's why, as far as this, even for students, for research scholars, you have to do some basic research.
Thank you, Professor. And thank you again for today for your nice presentation. Thank you.
Yeah,
Thank you, Dr.
Dr. Singla, that is quite understandable. That India, nothing much different. That one of the problem is also resources reallocation is one of the problem in your countries also. So
Yes.
thank you very much for your kind answer. And for both of scientists, Dr. Singla and Dr. Shafir, one of the leading scientists in parasitology field. Thank you very much for both of you. Well, let's
Thank you, Professor.
finish. We'll finish this session. Thank you very much. See you again. Bye bye.
Thank you. Bye.
Thank you, Chairman Professor Kesones Om, for coordinating the first scientific session for day 2 of second International Parasite Resource Bank Symposium 2021. Distinguished guests, dear ladies and gentlemen, for the next session, the participant and guests are welcome for a lunch break. We have one more scientific session after the lunch, and we will start our second and last scientific session for day 2 at 1 p.m. sharply. So I will kindly request all of the participants, please be available on our auditorium at 1 p.m. and also the online participant, please be available on 1 p.m. So see you again. Have a nice lunch. distinguished guests, ladies and gentlemen. Welcome once again in the second International Parasite Resource Bank Symposium 2021. How about the lunch? Hope you all enjoy the lunch. It is nice to see you all and hope that you are enjoying at the symposium so far. Now we are going to start our second and last scientific session of day 2 of the International Parasite Resource Bank Symposium 2021. The session is chaired by Professor Unmuk Sun. Now the mic is yours, Professor Unmuk Sun.
Thank you. Good afternoon, everybody. I would like to welcome you all to session 4, identification and taxonomy session. In this session, total 6 interesting and different topics will be presented by ready-made 50 files. Please. The first speaker is Professor Uday Kumar Mohanta. He worked for Department Microbiology and Parasitology, Sere-Bengala Agricultural University in Dhaka, Bangladesh. He's going to tell about taxonomic resolution of Ningua serrata lymph from cattle in Bangladesh through molecular markers.
Hello, dear audience and participants and respected professors from different universities. I would like to welcome you to my presentation on taxonomic resolution of Lingua serrata, nymph stage from cattle in Bangladesh through molecular markers. And this is Professor Dr. Uday Kumar Mohanto, Department of Microbiology, both as final host and intermediate host as well. And in the final host, the worm actually inhabits the nasopharyngeal regions and different sinuses. But in the intermediate host, they live in the different lymph nodes and liver, lungs. So here you can see the adult worm, and this is the female worm, and this is the male worm, and they lay eggs. The eggs passed out with the feces. Then they go through a series of developmental stages, and the intermediate host essentially get infected by ingestion of the eggs. Then these developmental stages occur within the intermediate host, and finally they form the lymph L8 to L9 in different lymph nodes or visceral organs, for example, liver and lungs. And when the carnivores and human consume the raw or improperly cooked meat of infected animals, so the human and dog can become infected. And as the human act as the intermediate host, they can also be affected by ingestion of the egg directly through food or contaminated drinking water. So, what are the pathological conditions actually can happen in human more specifically? So, Lingua chuleasis is a tongue worm, commonly called, and this is a cosmopolitan parasites, and they belong to the subclass Pentastomida. And there are several forms. When the human act as the final host, as I told you before, the worm inhabit the nasopharyngeal sinus. So they cause different forms like different manifestations like dyspnea, dysphagia, vomition, and headache. And these are called the Haljon-Marara syndrome. And this is more frequently occurred form in human. And a rare form, the ocular form, can also be found in human, which may lead to severe ocular pain, exophthalmia to photophobia, and finally, it may lead to permanent blindness of the human being. So when the human act as the intermediate host, there might be visceral form, as I told before. And this visceral form is not that much common as we find the nasopharyngeal form, but still there are some reports from Europe, Americas, and the Middle East. And in this case, there are hepatic or pulmonary malignancy and with no significant clinical signs. So actually, this worm has serious public health consequences actually. But the problem is about their taxonomical position, which have been previously set by the morphological properties. And this slide shows the morphology-based taxonomy of the worm. And you can see here, this is a subclass Pentastomida, includes two orders. One is the Porocephalida and Cephalobenidia. In Porocephalida, there are two different families. One is Linguaculidae and the Porocephalidae family. But in Cephalobenidia order, there are two families as well. One is Regardidae and Cephalobenidae. So according to this classification, the order Porocephalidae, that is the family Linguaculidae, should always lay very close, that is sister concern to the family Porocephalidae in the taxonomic tree of any kind. But when we go for molecular studies, we found that a Linguaculidae family has very close relationship to Cephalobenidae, which is actually unusual. It can never be happened. So therefore, we think that there might be some problem during the morphology-based taxonomy. So this is the major concern of this presentation. But still to date, unfortunately, there are very few reports on the prevalence of these pentastomids, that is Linguacula. And there are very few reports in the intermediate host from Middle East, South Asia, and there are only two reports of the worm from human in Austria and a dog from Norway. And these two studies included both morphology and molecular properties. Unfortunately, there is no comprehensive report based on morphology as well as detailed morphology and molecular properties of the nymphal stage in the intermediate host. So therefore, the objective of the study was set to characterize the nymphal stage of Linguacula serrata through their detailed morphology as well as the molecular properties. And the ultimate goal or objective of the study was to resolve the phylogenetic position of the worm in comparison to other pentastomids and insects based on two genes. One is 18S ribosomal DNA and other is the coxon genes. So in this study, we collected 9 worms from cattle in 3 different areas, which are highlighted here in the map of Bangladesh with red colors. One is Bogura, the northern part of the country, Mymensingh, and the southern part, Khulna. And the number of the worms collected from each locations are given in the parentheses. And here you can see the relative location or position of Bangladesh in South Asia. So the materials and method, what we followed, this is the worm actually. They were, after collection, they were pressed between the slides to make the internal organs visualized, and then they were preserved in 70% ethanol and then shifted to the laboratory. And for morphological studies, we first measured the length of the worm, their maximum width, and the distance from the anterior extremity to the maximum body weight. And then, and these measurements were basically done before the DNA extraction, and to keep the head intact. And we collected the tissues for DNA collection from the left side of the intestine. These tissues to avoid the important morphological features like the head part, their spines, as well as the intestine and other organs. And these tissues were preserved for DNA extraction, and the remaining body parts were subjected for staining with hematoxylin carmine solutions. And for molecular studies, what we did, we extracted the total DNA from the separated tissues, and our target were 18S ribosomal DNA and COX-1, and that were amplified by PCR and sequenced directly. And the phylogenetic analysis were conducted by maximum likelihood method. So in the results and discussion, this we can see here. This is the whole worm, and which is a slender, vermiform, and anterior extremity is broader than the posterior extremity. And you can see here the posterior extremity is gradually tapered at the posterior part, and there are several organs in the anterior part. For example, the buccal framework, the spine, hooks, accessory hooks, fulcrum, and which can be visualized if we just make a zoom. And here you can see the double star. Double star indicates the main hooks, and they are the first pair of the hooks started at the point of the first spine, and the second pair actually at the level of the second spine. And this is the buccal framework, and anterior to each of the spine there are some accessory hooks, and these are shown by the single star. And here you can see the area of the hooks was shown by the broken lines, and the solid lines, these solid lines was displayed here to show how we measured the hooks or their area, and similarly for the accessory hooks here. So here you can see in the figure A about the posterior extremity of the worm, and you can see here this is the anus, and for the B it was zoomed to show you the ring spines, how they are oriented here from the posterior extremity of the each ring. And in this picture C, we showed how we measured the spine length and how we measured the interval between the spines or the length of the each ring. And here this table describes the detailed morphometric data, and I'm not going to read all the data here. I'll just focus on several points. And the average length was 4.2 millimeter, and this is the reference values, and we only found this paper including where the morphometry was included almost in detail, but we went for further detailing actually. And the distance here, they didn't show it, and the whole worm contained 80 to 94 segments with an average of 88, and the interval between the first and second ring was on an average 0.12 millimeter, which was very close to the reference value. And for the ring interval and length of the ring spine, it gradually decreases from the anterior part to the posterior part, which was in line with the previously found report. So these are the morphometry, and with this molecular, so for example, the morphological features as well as the morphometry, we identified the nymphs as the nymphal stage of Linguacola serrata. So here, this slide shows you the molecular data, and this is the maximum likelihood tree inferred from 18S ribosomal DNA. And though we amplified 1000 base pair, but for aligning, we included here 913 base pair. And the model we followed here is to Kimura 2-parameter model with gamma distribution, and here in the tree we can see the LSBD. This is the only genotype we found from 7 worms analyzed for molecular studies. All showed the identical DNA sequence with no deviation. So we found only one genotype here, which is designated as LSBD, and it has 100% similarity to the sequence deposited from dog in Norway and from the goat in Iran. But and this and other sequences deposited in the gene bank, and this clade, they formed a monophyletic clade here, and very close to this clade we can see here another clade with another species of the genus Linguacula serrata, which is Linguacula arctica. But unfortunately we found here so I have a bit completely different from Linguacula serrata or arctica. This is Linguacula serrata, which is deposited from Austria, and the isolates were taken from human, and it has dissimilarity with the Linguacula serrata with 98.3%. So probably this isolate was morphologically misdiagnosed, or probably they had some ambiguity in the DNA sequence. The most important thing is here, we already showed you in different colors. This color shows two families. One is Porocephalidae family, and the other one is the Linguaculidae family. So both of these two families are in under the order Porocephalida. And here, this color actually for the Cephalobenidae order, having two families. One is the Cephalobenidae and Rigardidae. So if the morphology-based taxonomy is very nice, so it should be like the Linguaculidae and Porocephalidae, and they should be close together. But we can see here the family Linguaculidae is much closer than closer to the order Cephalobenidae rather than the family Porocephalidae in the order Porocephalida. So there is a mismatch with the morphology-based taxonomy with this molecular-based taxonomy. So let's have a look on the coxon gene. What happens here? And we also amplified 1013 base pair, but for aligning, we need to use only 605 base pair. And here, the model used is Hasegawa-Kishino-Yano model with gamma distribution. And we found 4 genotypes, and having 99.7 to 99.9% similarities. And there were only 0.1 to 0.3% intraspecific variation. And here, one thing is to be mentioned here, like Linguacula serrata, this sequence had 100% similarity with LSCOY1 genotype. And so they formed a monophyletic clade here, and very close to this clade, the sister clade was formed by Linguacula arctica. So here, the relationship between Linguacula serrata and Linguacula arctica was very nicely depicted. So the Linguaculidae family, like 18S ribosomal DNA, they formed a very nice clade here. But like the 18S ribosomal DNA, you can see here the Cephalobenidae family, which is under the order Cephalobenida, is closer to the family Linguaculidae. But it should be, the Linguaculidae family should be closer to Porocephalidae, as these two families are included in the order Porocephalida. But it is not happening here. And again, one more interesting thing is like that. These two orders, Porocephalida and Cephalobenida, these two orders are under subclass Pentastomida. So these areas are for the Pentastomida subclass. And though they are classified under Insecta, but we can see here they have a very close relationship to Nematoda than the other members of the Insecta. So from this observation, we can say that like the subclass Pentastomida probably the intermediary form between Nematoda and Insecta. So from both of the two trees and morphological identification, we can come to a conclusion like the complete identity of the all the worms we studied here by 18S ribosomal DNA form the complete identity. So the 18S ribosomal DNA can be very useful for the DNA barcoding of the worm. And again, the COX-1, though it is variable, but it is not that much variable here in the Insecta, but they can be used to assess the intraspecific variation, that is for genotyping of the worm. And the phylogeny constructed from both the gene loci actually contradict with the morphology-based taxonomy, which have already been established. So therefore, actually very difficult here to make a comprehensive study, like there are insufficient molecular data for other pentastomids to enable taxonomic resolution. So therefore, our suggestion is to either we can go for revision of the morphology-based taxonomy, which have already been established, or we can again go for making the taxonomic position by including the molecular data from extensive range of taxa, including different orders, families of different insects, as well as the different members of different families under the subclass Pentastomida, to make a concrete conclusion for the real taxonomic position of the worm. So thank you very much for your kind attention.
Thank you very much, Professor Moanta, for your excellent presentation. Do you have any questions, comments? I will briefly mention these topics. Lingua tulacerata is a species of pentastome or tongue. Pentastome infection, pentastomiasis, is a kind of a rare zoonotic disease in humans. In this presentation, larval tongueworms recovered from the lymph node of Kerala in Bangladesh were identified as Lingua tulacerata based on the morphological and the molecular characteristics. Additionally, the molecular findings suggested that Lingua tula species is closer to the species in the order Cephalopenida rather than those in order Porocephalida. Therefore, the taxonomic problems on the validity of order level taxon is remained to be solved by the future studies. No questions? Move the next topic. The second speaker is Cherendol's Munkruzarkar. He works for Institute of Veterinary Medicine and Graduate School of Mongolian University of Life Science in Ulaanbaatar, Mongolia. He is going to tell about microscopic and molecular detection of Dryopronema evansi in domestic Bacterian camel, Camelades bacterianus of Mongolia. Please show me the topics.
Hello, everybody. My name is Mukhtargar. I am a researcher of Institute of Veterinary Medicine in Mongolia. It's my pleasure and honor to participate in this conference. So today I will briefly present our research work entitled The Microscopic and Molecular Detection of Theraphronium avansii in domestic bacterial cases of Mongolia. The livestock sector is fundamental to the Mongolian economy, and the industry consists of sheep, goats, cattle, horses, and camels. Especially camel rearing is an important component of the livestock farming. Although Mongolia possesses the largest bacterial camel population in the world, but the camel population of Mongolia has been decreased in past decades. As shown in this figure, over 895,000 heads of camels counted in 1954. It had been decreased 3 times in 2010 due to inaccurate policy, mismanagement of camel herding practice, improper socialization and privatization of camels, and weather-related disaster. Also, in the camel industry, serious economic loss caused by infectious disease, including parasitic infection. Therefore, early and correct diagnosis is essential to initiate proper treatment of the disease. So, Camellia fluorosa Bacillonimus is caused by Bacillonimus nematode, and is an economically important infectious disease affecting the camel industry in the world. The life cycle has not been described in detail, but mosquitoes of the genus Aedes and Culex species are intermediate hosts for this nematode, and the definitive hosts are both dromedary and bacteria. In the case of Mongolia, the avansii worm was first detected from bacterial camels in 1953. The status of fluorosis among camel population of Mongolia was not clear. Recently, Parasite parasite diagnosed incidentally in peripheral blood of domestic bacterial camels during the surveillance of trypanosmosis in Mongolia. Therefore, aim of the recent study was to detect and identify microflora of the avansii in bacterial camels of Mongolia. The study was conducted in 3 provinces located south in the west part of Mongolia, identified with the larger camel population. Totally 400 blood samples collected from domestic bacterial camels of these 3 provinces between September 2019 and June 2020. Then all blood samples transferred to Institute of Veterinary Medicine for water examination. The all blood samples examined by both direct blood smear techniques and the modified Connacht's method for detection of the parasite, and then DNAs were extracted from each blood sample, then screened by PCR assay for species identification. Furthermore, positive PCR products were sequenced for phylogenetic analysis. Results: out of 400 examined camels, 30 were positive for microflora by modified Connacht's method, while microflora were detected 13 camels by direct blood smear. In contrast, 18 camels were positive for microflora by PCR assay. Among the study area, Howth province, were 23% animals positive for microflora was identified high relatively risk area. We also analyzed diagnostic data based on gender and age as risk factors. Resulting infection was common among young aged group of camels, while lowest positive results obtained for camels in middle-aged group. Although female camels include more flora-positive animals than males, but the difference was not statistically significant. In the comparison of different diagnostic techniques, 12 samples positive by microscopic examination, but negative by molecular diagnostic techniques. Resulting occult infection was detected in 40% of the samples. Of 50 detected microflora, 30 were measured for morphological characterization. So in the present study, microflora were unsheathed and about 255 micrometer length and 3.2 micrometer weight. Anterior of microflora blunt head and the posterior fine pointed tail. Inner mass and pinkish and located in third quarter limbs of the microflora. In genital cell, one was located anterior of inner mass and genital cell 2 was located posterior of mass. And genital cells 3 and 4 were found close to genital cell 2. In the cephalic species, devoid nucleus and located anterior end of microflora, and there are neurobrains and vesicle, excretory vesicles were located near to anterior end of microflora. And the anal pore was located close to posterior end. Regarding the observed morphological feature of the microflora in the present study, no contradiction with the previous description of D1C microflora. But microscopic examination is not enough species identification. So before analysis of divergence for cytochrome C oxide subunit 1 gene confirmed for morphological identification. In the present study, the D1C gene sequence from Mongolian 2 Hambot kinase were identical to sequence from Iranian 1 Hambot kinase, with the identity was over 96%, and then clustered with in the phylogeny. And the identity among Mongolian COE gene sequence ranged from 75% to 100%, and similarity between amino acid sequence were between 77% to 98%. In addition, D1C and other diabetic species were found not monophyletic. In summary, 400 blood samples were collected from pastured camels in the 3 provinces of Mongolia and then screened, resulting in microflora of D1C are present in bacterians of Mongolia. The prevalence was common among young and female bacterian camels, and among the study area, Hot province is a high risk area for chlamydian fluorosis. Furthermore, combination of microscopic and molecular diagnostic techniques might be useful to detect circulating microflora in the occult infection. And in addition, D1C gene sequence from Mongolian 2 Hambot camels were identical to sequence from Iranian 1 Hambot camels. The flora nematode from these carrier animals may be transmitted to susceptible camels by mosquito vectors, resulting in outbreak of chlamydian fluorosis and gram-gloss. Therefore, proper strategies should be formulated and implemented to control chlamydian fluorosis in this area, especially hot provinces. So this work published in Journal of International Parasite International. So you can find more information about this study. And then the study was supported grant of CBNU International Foundation for Science. Thank you very much for attention.
Thank you very much, Dr. Munkarzal, for your nice presentation. I will briefly introduce again the main contents of this topic. Dryophoronema ebanzi is a filarial nematode and act as etiologic agents of filariasis in camelid hostes. In this study, total 400 blood samples from the same number of healthy 2 bacterian camels, Haemophilus bacterianus, were examined using 3 kinds of diagnostic techniques: NOT technique, direct smear, and PCR assay in Mongolia. The efficacy of 3 diagnostic techniques were evaluated to detect the microfilariae of Dryophoronema ebanzi in bacterian camels of Mongolia. Additionally, it was first confirmed that diafragm Evans CO1 gene sequences are identical with those from the Iranian one-humped camels in this study. The third topic is will be presented by Professor Ujulge Oktay Ayan from Department of Parasitology, Faculty of Medicine, Van Yüzünkuyul University in Van Province, Turkey. The topic is investigation of Giardia intestinalis positivity in direct patients in Van Province by a native Nugor and nested PCR methods. Please.
Positivity in diabetic patients in one province by natively born and nested PCR method. Giardia intestinalis is a flagella protozoan parasite infecting the upper intestinal tract of humans and a wide variety of other mammals worldwide. The infective dose is thought to be as low as 10 cysts, facilitating transmission from host to host. Giardia duodenalis is transmitted to new hosts through the fecal-oral route, including direct contact with human or animal face containing cyst or consumption of cyst-contaminated food or water. Giardia intestinalis is one of the most common intestinal parasites in humans throughout the world, with an estimated 200 million people infected. Giardiasis has a cosmopolitan distribution. Children are the most susceptible target. High-risk groups include infants and young children, the elderly, institutionalized individuals, travelers, and immunocompromised individuals. Furthermore, a number of factors such as socioeconomic and sanitary conditions, geographic area, diagnostic sensitivity, and healthcare accessibility, among others, can be associated with the prevalence of giardiosis infection. This parasite is capable of surviving in an inhospitable environment and continues to infect more hosts due to its simple but efficient life cycle, which presents two stages. One, the horizontal that colonizes the gastrointestinal tract and causes the disease, and two, the cyst, which is responsible for host infection. Giardia duodenalis is also very commonly reported in domestic animals and wildlife, and numerous prevalence studies have been reported worldwide, particularly on livestock. There are marked variation in reported infecting rates and cattle, pigs, sheep, and goats, likely due to the age of animals, their management practice, and the detection methods used. In most such studies, young animals demonstrate higher prevalence rates than adults. The infection rate is also high and very heavy in population animals, especially dogs and cats. Most infections are related to self-limiting acute watery diarrhea, but chronic infection can result in weight loss and malabsorption. In humans, giardiasis is associated with stunting, wasting, and cognitive impairment in children. Acute giardiasis might disable patients for extended periods by eliciting protracted post-infectious syndromes, including irritable bowel syndrome and chronic fatigue. Giardiosis is common worldwide. It is a zoonotic disease that causes especially waterborne epidemic. The prevalence of Giardia intestinalis is one of the most common intestinal protozoan parasites and transmitted by the fecal-oral route. It is directly related to lack of personal hygiene and sanitation. The first option in the diagnosis of this parasite is usually microscopic examination of stool samples. The diagnostic value of microscopy might decrease due to the low application cost, rapid loss of typical morphology, and motility of trophozoids. Intermittent extraction of kits and inexperienced personnel. Many studies have been conducted in world and in our country to investigate the prevalence of giardiasis in humans using different methods. In some of these studies, the diagnosis method or the prevalence of the direct parasite. In others, the effect of diarrhea on the prevalence was investigated. Why we need this study? In this study, it was aimed to investigate the frequency of Giardia intestinalis with native local and native PCR methods in patients with diarrhea who applied to 100. Yıl Üniversitesi Dursun Odabaşı Medical Center and to compare the diagnostic value of these two methods. The study was carried out at 100. Yıl Üniversitesi Dursun Odabaşı Medical Center Parasitology Laboratory and Medical Faculty Parasitology Department Research Laboratory between 2020 and 2021. In the study, residual stool sample collected from a total of 100 patients with diarrhea aging between 18 and 90 years. That included 58 females and 42 males were used. Two samples were examined within 1 hour of collecting. A drop of physiological saline was placed on one side of the slit and a drop of Lugol solution on the other side for 10 smears. A simple amount was taken from the stool sample with the help of a toothpick and mixed first with physiological saline and then with Lugol solution. Results in this study, the positivity of Giardia intestinalis using native Lugol method was 10.3%, 9.5%, and 10% in female, male, and all the patients. To The positivity of Giardia intestinalis using nested PCR method is was detected in 12.1 of female, 14.3% male, and 13% of all the patients. Considering nested PCR as the gold standard method, the sensitivity or specificity of native glucose method used as a comparison method were 76.9% and 100%. In terms of the positivity of the parasite, there was no statistical difference between the nested PCR and native glucose method. In the order of frequency, the patient also had complaints of weakness, weight loss, nausea, and abdominal pain in addition to diarrhea. Varying levels of significant differences were noted between Giardia intestinalis positivity and all complaints in the statistical evolution. Conclusion. In conclusion, it may be appropriate to consider Giardia intestinalis as the cause of diarrhea in patients fleeing to the hospital, and the conclusion to confirm the diagnosis with a second method having high reliability, low cost, and giving result in short time by not limiting to native glucose method in routine diagnosis has been reacted.
The third and the fourth topic is similar contents. Therefore, we will discuss together after the first topic presentation. The first topic is nested PCR detection of Giardia duodenalis in stray dogs in Kütahya, Turkey. In this topic, it will be presented by Professor Adnan Ayan from the Department of Genetics, Faculty of Veterinary Medicine, Van Yüzünköy University in Van Province, Turkey. Please.
Hello participants, myself Dr. Adnan Ayan. My presentation topics: nested PCR detection of Giardia duodenalis in stray dogs in Kütahya, Turkey. Giardia duodenalis, an intestinal flagellated protozoan, is commonly encountered worldwide in humans and various animal species. Infection may occur through fecal-oral transmission of kiss by direct contact or during water-food consumption. Clinical manifestations of giardiasis in dogs are variable, ranging from the absence of symptoms to dehydration, vomiting, acute or chronic diarrhea, abdominal pain, and weight loss. Diarrhea is primarily the result of hypersecretion and intestinal malabsorption. Younger or immunosuppressed dogs may be prone to the effects of disease. Diagnosis of infection is typically based on the detection of kids by fecal flotation. Moreover, giardiasis can be diagnosed by ELISA-based rapid test kit and PCR or DFAT methods. Molecular techniques have reported higher sensitivity than microscopy for epidemiological studies. Giardia duodenalis is recovered from the feces of both symptomatic and asymptomatic dogs worldwide. The prevalence rate of giardiasis in dogs likely varies depending on the population, living area, method of diagnosis, age, and health status of the animal. A recent review and meta-analysis of 127 studies on giardiasis in dogs worldwide suggests an overall prevalence rate of 15.2%. A higher prevalence of infection, up to 100%, has been seen in younger dogs housed in shelters or breeding operations. Giardiasis is considered an important zoonotic disease. However, molecular characterization is necessary to determine the zoonotic potential of Giardia duodenalis. Epidemiological and molecular studies have reported the existence of these 8 assemblies from A to H. Assemblies A and B have been known to infect humans and animals, whereas the others are mostly host-specific to animals. Dogs commonly harbor species-specific assemblies C and D, although potential zoonotic assemblies A and B are frequently amplified from canine samples. In this context, dogs are seen as potential reservoirs for human infection. Giardiasis in dogs is important because of its highly prevalent rate of infection, acute or chronic clinical symptoms, and potential zoonotic risk. However, limited information is available concerning the epidemiology of Giardia duodenalis in dogs from Turkey. Prevalence rates in dogs have been reported between 3.3 and 30 from stray dogs. Fresh fecal samples from each dog were manually collected from the rectum using a disposable glove. Samples were kept on ice until laboratory examination. Diagnosis of Giardia duodenalis infection was microscopically determined based on the detection of cysts in fecal samples. For microscope native Ligor methods, stool samples were examined within 1 hour of collection. A drop of physiological saline was placed on the one side of the slide and a drop of Ligor solution on the other side for these smears. A small amount was taken from the stool sample with the help of a toothpick and mixed first with physiological saline and then with Ligor solution. Then a cover slip is covered on the smears and it's placed in the vortex objective of the microscope. It was examined for Giardia duodenalis. DNA extraction. DNA extraction of the 200 samples was achieved using kinematics to DNA purification kit. We applied kinematics to DNA purification kit protocols. The extracted DNA was preserved at -20 degrees centigrade until further analysis. Next, PCR. PCR amplification follows the procedure previously described by Kakua and Fan. Beta-GRD gene consists of 753 base pair fragment was amplified using an appropriate primer. Ten common appropriate primers: G7 forward, G759 reverse primers, 200 micromolar BNTP, 1.5 millimolar magnesium chloride, 1 unit Taq polymerase, 10x reaction buffer, and 2 microliter DNA was related to volume of 25 microliter. DNA was denaturated at 95 degrees centigrade for 15 minutes. Initial denaturation. Denaturation at 95 degrees centigrade for 30 seconds, followed by annealing at 60 degrees centigrade for 30 seconds. Extension at 72 degrees centigrade for 60 seconds for 35 seconds, followed by final extension for 7 minutes at 72 degrees centigrade. Two DNA copies of 753 base pair fragment beta-gliadin gene were separated using 2% agar gel. The gel was stained with red safe nucleic acid staining solution and visualized with UV transillumination. Another 511 base pair fragment of the beta-gliadin gene was amplified according to the primer described by Zahler and Fan. The above-mentioned procedure was employed to obtain the copies of the beta-gliadin fragment, but with a different primer: PG1 forward, PG2 reverse primer. 10th common appropriate primer: PG1 forward, PG2 reverse primer, 200 micromolar TNTP, 1.5 millimolar magnesium chloride, 1 unit Taq polymerase, 10x reaction buffer, 2 microliter DNA was elevated to final volume of 25 microliter. DNA was denaturated at 95 degrees centigrade for 15 minutes. The DNA copies of 511 base pair fragment beta-gliadin gene were separated using 2% agar gel. PCR protocol: denaturation at 95 degrees centigrade for 30 seconds, followed by annealing at 55 degrees centigrade for 30 seconds. Extension at 72 degrees centigrade for 60 seconds for 35 seconds, followed by final extension for 7 minutes at 72 degrees centigrade. The gel was stained with red safe nucleic acid staining solution and visualized with UV transillumination. Results: microscopically, Giardia SBP kits were detected in 38, 19% of the 200. You are seeing two pictures: Giardia cyst. Giardia intestinal cyst seen in the native Lugol method in 40x length. According to the result of nested PCR in 42 samples, 21% Giardia duodenalis were found as positive. You are seeing two pictures. 2% GI electrophoretic separation of PCR amplification products from positive samples in the next PCR analysis. M marker and negative control, A positive control, 1, 2, 3 positive samples. It has been determined that in dogs in Kütahya region, Turkey, Giardia duodenalis is quite commonly observed. Moreover, it has been suggested that further precautions be taken. Thank you very much for listening to me.
Thank you very much for your nice presentation. We will discuss all together after the sixth topic presentation. The presentation order is changed between fifth and the sixth topics. The fifth topic is morphometry and the molecular identification of Haemonchus nematode strongyloides isolate from small ruminants in Tanzania based on the mitochondrial COX-1 and the ribosomal RNA and ITS genes. This topic will be presented by Parakeli Abdeli Ondosi. He is a member of Tanzania Wildlife Management Authority in Morogoro, Tanzania, and iPRB in Tanzania. Please.
Welcome again to the International Parasite Resource Bank Symposium 2021, and I'm happy to be part of the symposium. Today, I would like to talk about morphometry and molecular identification for Haemonchus isolate from small ruminants in Tanzania based on mitochondrial COX-1 and ITS gene. My name is Parasite Abdeli Ndosi from International Parasite Resource Bank in Tanzania side, and also working together with Kukun in the Parasite Resource Banking in Tanzania. Of course, we have several projects working in Tanzania, especially Serengeti Wildlife Research Center in wildlife per se, as well as in the livestock or domestic animals. The genus Haemonchus are nematodes of domestic and wild ruminants. They are significant spread in tropical, subtropical, and warm temperature region. They are orally transmitted to all classes of ruminants, of course, and the effective larvae, which are normally based on the leaves, they are taken by the ruminants during the grazing, and they are taken direct to the abomasa where they burrow there and develop into the adult worm. During the development, they cause a lot of detrimental effect on the gastrointestinal line, including the anemia, edema, and also they reduce animal production, and death may occur during all this process. Back to Tanzania, several species of Haemonchus has been mentioned to domestic ruminants and wild ruminants. Mostly the Haemonchus contutus and placea has been mentioned to domestic ruminants and has been more classified to species specific, especially the Haemonchus contutus being placed to small ruminants and Haemonchus placea being mostly mentioned to large ruminants, for example, cattle. These are the perceptions which has been normally speculated to several researchers related to the species specific, but some of the findings has been narrating the information by including both of the species in one host, which means one host can have can host both Haemonchus contutus and Haemonchus placea. But in wildlife per se, some of the species has been mentioned, and most of the wildlife species mentioned, including the small ruminants, of course, the impala, the Thompson gazelle, the dik-dik, and so forth. Developing the identification procedures for the Haemonchus species has been also conducted, but in very low progress, particularly in Tanzania side, and they are high demanding for the morphology and molecular information related to Haemonchus in ruminants in Tanzania. So this study is trying to explore more information on the identification of Hymonchus species based on the morphology and the molecular genome, particularly on the mitochondria COX-1 as well as the ITS gene. During this study, the area of our interest was in Tanzania, of course, in the northern part of Tanzania, particularly Manyara region, and the Babat district, which is almost the large district in Manyara region, and mostly the important three villages, the Magugu, Kiru, and Ayasanda. These villages were selected purposely due to the culture of livestock keeping and also the climate of the area, which is mostly favor the availability of Hymonchus species, and also the mixing of the livestock, the different kind of livestock mixed together, but also the area is mostly favored to the various kind of studies related to parasites due to the community availability and also the nature of the geographical position of the area. Therefore, 5 sheep were selected randomly of the age of 8 to 10 months, and mostly we have preferred the sheep which were not dewormed recently, but also the collection period was the June 2020 to January 2021, and based on the climatic condition of area, as I mentioned on the previous slides, and our good interest area of the part of the study was abomasum, which is the target one, and the way of identification was normally based on the morphology and the molecular basis. Therefore, the isolation of the worms were conducted based on various researchers which previously did the work, and the gastrointestinal tracts of the selected sheep were double ligated at the aperture into 3 sections to prevent mixing of the abomasum, small intestine and large intestine contents. Each tract were placed in the bucket so as to label them before processing and do some small procedures to ensure that we are not mixing, and the abomasum were isolated, open along the greater curvature and washed, and the content were collected in sterilized container. Then the abomasum contents were filtered, and also to ensure the quality of the sample, more isolation procedures were followed, and all the procedures, including the using of the normal saline and all the important aspects to ensure that we collected the proper specimens were conducted and stored to the 70% ethanol as well as 10% formalin. The 70% ethanol was purposely for the molecular information or the DNA extraction and support, while in the 10% formalin were purposely for the morphological identification of the species. During the identification of Hymonchus, the morphological identification of Hymonchus was normally based on the preparation of the worm as well as fixation procedures, as I mentioned before. But the important aspect for the identification was based on the dorsal ray in the spicules in male, but also in female, the valvular shape and the cuticular process was the most important aspects to consider during the identification procedures. In the molecular identification of Hymonchus species, the PCR amplification were used the 50 unigram of the genomic DNA template with the recipes as presented, but also the conditions were well set, including all the important aspects to ensure that we yield the quality fragments for the further procedures in the analysis. And the phylogenetic analysis was evaluated by Bayesian inference and maximum likelihood, which are the robust tools for the phylogenetic analysis. Also, the MEGA software was used and other procedures as indicated on the slide. Let's see the results. A total of 406 nematodes were recovered from the 5 sheep in the Babat district, Abata. And the total number recovered, 106 nematodes were distinguished by 37 males and 69 females, which means the large number of worms, high percent was female and the rest were males. Also, the high number of parasites recovered in the abomassa were similar size, except those from the female shape observed to be larger than in the male shape. So let's appreciate on the general morphological feature for Ammoncus contortus, starting with the dorsal lancet at the anterior part, which are protected from the dorsal wall. We have the cervical papilla, which are span structure light protruding outside or more or less parallel to longitudinal cuticular ridge. And on the posterior part, we have the important parts which we need to talk about, the arrows which are first made for chemorepulsion behavior, but also we have the dorsal ring, which is covered along with the anus and the marsos. Of course, these posterior parts are very important features to make the development of the worm inside the environment or inside the host, which normally they tend to have various aspects on the adaptation and the surviving of the parasite in the house. Well, let's see another feature, which is the highly visible transverse striation on the body wall, but also we can see the uterus covered with some eggs. But also we have the another features in female, which are the anterior fundibulum, and we have the sphincter as well as vestibular. So these are general features which are variable features seen through the worms. And yeah, let's see more information about the Ammoncus contortus. In the appreciation of the morphotypes, let's see the female morphotypes. Before proceeding, I would like to say the morphometric features in female nematodes associated with the vulvar position with or without prominent feature along with its structure. For instance, the shape observed here, it seems this is the vulvar position side where we have the general features, the fundibulum, sphincter, and vestibular, but along with they are smooth, which means they are nothing developed outside the vulvar position. So this is smooth morphotype. But when we see the next one, we have the other, which develops some knob structure along with the vulvar flap, which is normally termed as the knobbed morphotype. And another feature is the linguiform morphotype, which they have the long process form the linguiform, but there's nothing else developed along with. So this is linguiform structure. But we have another linguiform structure, which they have additional structure formed within the cuticular process. So this is another kind of important features to be considered. But we have another linguiform structure, which along with the linguiform, there is a cuticular process formed within. So in general, we can say the morphotypes in female are of three different types: the smoothy one and the knobbed one, and the other one is the linguiform. But in the linguiform, structures are further classified to the linguiform with no cuticular process. For this study, we call it the linguiform B. But the linguiform with a single cuticular process, we call it the linguiform A, and the linguiform with the cuticular process developing along the linguiform process, we call it the linguiform C. So let's get back to male. In male, the important three features are to be considered: the spicules, the genital horn, and the dorsal ray. In spicules per se, we can see the spicules of the, more or less the two spicules look similar, but on the important barbs are variable, are very important to be considered during the identification of Ammoncus. For instance, the Ammoncus contortus, the barbs are of different size. This one looks like a species. They are vary according to the observation of the dorsal ray, but also the barbs on the spicules, they are quite different compared to Ammoncus contortus. For the molecular description, the average nucleotide divergence among the Ammoncus contortus is almost 1.03%, while the important population, the Ammoncus contortus and Ammoncus placei, all retrieved from the gene bank, is normally a variation of the 2.35%. As I said before, the COX-1, which are partially fragments of 277 base pair to 317 base pair fragments of Ammoncus contortus isolates, show 98.6 to 99.7 similarity in male smooth knob linguiform A, linguiform B, and linguiform C morphotypes, which of course were compared with the isolates from the GenBank, and also in the ITS genes, the similar results of the percentage-wise, 98 to 99%, but the base pair or the fragments of this IGS was almost 520 to 532. So all the sequences were analyzed and all the were deposited on the GenBank with the references which could be used for further study. So in very short summary on the genetic divergence among the homunculus computers based on the male and the female, in both the male and the linguiform types like the linguiform C, linguiform A, linguiform B, smooth and knobbed, were compared with the GenBank references. But most important thing which I want to add among the information is the morphotypes variation. There is no significant differences among the morphotypes, which of course has been reported to several researchers. Like the morphotypes are just variable features for the homunculus species. So this study also is supporting this kind of information. Rather, the morphotypes could be important in the other aspect, for example, the adaptation in the surviving, in the hosts and so forth. Phylogenetically, the relationship among the homunculus computers and other blood-sucking nematodes, the homunculus computers were, of course, the kind of phylogenetic tree was constructed under the maximum likelihood and Bayesian inference, as I said before, based on the mega. And this study divided into, or grouped them into three classes. The first cluster was homunculi, which are Parasite, including the large group of homunculus computers, which was, of course, exploited in this study with the other references, but also homunculus placei, and also we have the Teloscius constricta, but also we have the Mesistorus, these important kind of nematodes on the Abomasum parasite, but also Molidi, intestinal parasite as the nematorials, and also the free-living, the C. elegans as the free-living parasite. So in a very short summary, we can say the homunculus computers in this study conducted reveal with some references from the GenBank, but also it is like the sister species within the homunculus placei, but other clade of the Teloscius constricta and also the Mesistorus digitatus kind of species being placed into these kind of clades in the very big cluster of homunculi or Abomasum parasites. For the ITS gene, the 5.8As and the ITS2 partially were also revealed, as I said before, but the phylogenetically, it reveals the grouping of the species of the homunculus and the homunculus contutus and placei as the related species on the Abomasum parasite, but also the other looks similar to the COX-1 information, as I said before. Therefore, the asymmetrical length of dorsal ray with branch nose toward the dorsal lobe margin and the distance of bulb at the apex of spicles were important structure for male identification. Morphologically, these are very important keys to distinguish the homunculus contutus and other homunculus species. The shape and the structure for the spicles as well as the dorsal ray, or the causing of morphotypes and the resistance of the morphotypes, the female nematodes, female homunculus to the host. Also, this kind of speculated information has been well exploited, and this study is also supporting some of the information related to geographical location, but also the adaptation of the homunculus based on the morphotypes. Also, the presence of these morphotypes are associated with the trophic condition, also, caused based on the environmental factor. So the geographical information is very important matters to discuss on the relation with the homoncus and the environmental factor at large. But we provide the phylogenetic relations among the link from and morphometric observation in this study. And the availability of the genetic information are the vital tool for the management of parasite disease for easily identification of specific parasite infecting the host. So for this study, I would like to say the continued persistence of homoncus is related to the genetic drifting, mutation, and modification of the morphological feature described to have impact on the development of drug resistance. Species identification is necessary to understand which species infect the animal's host, and the use of molecular marker identification could provide more information on the genetic variation for the species that could provide more information on the treatment procedures, including drug discovery. Therefore, we recommend more studies on the parasite intensity and the strategies for controlling homoncus species in Tanzania. Ladies and gentlemen, thank you so much for your time. Thank you so much for listening. Thank you so much for attention. Asante sana. Bye-bye.
Thank you very much, Dr. Ndosi, for your excellent presentation. The quality of photo and the genomic findings are very good. The final speaker is Dr. Muhammad Hossein Vanessa. He is a member of Scientific and Technical Research Center for Arid Areas Biophysical Station in Nejera, Togo, Algeria. He's going to tell about serological and molecular investigation of trypanosomiasis and the potential risk factors among livestock in Algeria. Please.
Thank you. Thank you, Monsieur. Thank you, Mr. President. Did you hear me? Sorry, did you hear me?
Yes, it's fine. Please carry on.
Okay. Okay, great. So, thank you. I am very happy to be with you and to participate in the International Symposium of Parasite Research Bank in 2021, and to share with you some results of our studies here in Algeria. So I will talk about a big issue here in husbandry systems in Algeria. It's the Trypanosoma evensi. I will talk about the serological and molecular investigation of Trypanosoma evensi and their potential risk factors among livestock. As you know, camels are unique among livestock species in their ability to thrive in arid environments, providing an important source of food and financial security to a vulnerable community. In the historical past, camel production has long played a vital role in nomadic and pastoral community, but formalized production aimed primarily at lucrative urban milk market, as well as thriving international export market and increasing importance. So I will talk about a big problem, a big parasite problem here in Algeria and in different other countries in North Africa and in Asia about Trypanosoma evansi. And these parasites are very important, knowing that they are living in very hostile environment and they are resistant in arid area, and there are a lot of genetic. So I will talk about some serological finding about this parasites and also about the molecular biology. Knowing that Trypanosoma evansi is a parasite known in order of Kinetoplastida family, and it's transmitted mechanically from infected blood of animals, and it's not capable of cyclic development in Glossina, morphological and distinguishable from Trypanosoma brucei. Trypanosoma evansi can survive only for short period outside the host. It disperses quickly from the carcass after death. Fly no longer transmitted the parasite after 8 hours. The major species that can affected by Trypanosoma evansi is camels. Camels are affected by several Trypanosoma evansi. Trypanosoma evansi is the etiological agent of Sura. Is the most prevalent Trypanosoma species of camels. This species can be mechanically, as I said, transmitted. A recent outbreak of infection amongst dromedary population on the Canary Islands, in mainland Spain, in France, in Ethiopia, in different regions of camel farming system was detected. The infection may cause, for symptoms, the infection may cause significant morbidity and great impairment of productivity and mortality. It is assumed that the spread of Trypanosoma among camels with consequence of fatal anemia. As I said also, it can affect other species, saying about buffalo, cattle, dogs, equids, and small ruminants. But in contrast to the other species in camels, the economic burden of this infection has not been evaluated in a lot of regions and in a lot of countries. Human cases of Trypanosoma evansi infection have been reported from India, Sri Lanka, Egypt, and Thailand. A recent report of infection in a patient with no previous immunological risk with 2 wild type Apollo allele and a normal serum Apollo concentration suggests that Trypanosoma is very true zoonosis with a risk of infection to the general population. About the symptom, we can talk about Trypanosoma evansi as an important constraint of camel and animal production because it reduces productivity and economic losses. It is a major endemic disease problem throughout Central and South America, Africa, and Asia. Infection with Trypanosoma evansi reduce market value of exported animal, as we will see, decrease milk yield and lessen animal body condition score, resulting in more than $223 million in losses in the camel industry. In addition to this economic problems, Trypanosoma evansi is the most cause of infectious abortion in camels in Middle East camel with clinical disease can present progressive emaciation, severe anemia, reproductive problems. As we can see in these photos of camels affected with trypanosoma, with chronic trypanosoma evency. For our study, the present study was therefore conducted to investigate the epidemiological distribution of trypanosoma evency in livestock in the southern east of Algeria, and also some molecular characterization of this parasite derived from naturally infected dromedary camels. Also, we worked on caprine and equine in Algeria. Blood samples were collected from 965 camels, 360 goats, and 78 equine from 3 provinces of Algeria. This is the region where we worked in Algeria. It's in the border with Tunisia. So we used the serological techniques by camel blooding sampling, and we tested this blood with the card agglutination test from trypanosoma evency. For the molecular side, we use molecular characterization of trypanosoma evency by DNA extraction of camel bloods. So we need some total genomic DNA with the total genomic DNA was extracted from 200 microliters of ADR preserved whole blood for each of the camels. So either with the economic issue and we cannot work on the whole sampling blood camels. So we extract from 148 camel blood camels, and so we did the DNA amplification and sequencing of ITAs ribosome spacers. We did some genomic DNA samples and other. For the results, so of the animal examined, we found 49.5% of dromedary camel were seropositive from trypanosoma evency. A high percentage of goats were seropositive, it's about 84%. In equine, we found 30% of the animal examined were seropositive. So we do a lot of statistical work about the major risk associated factors to this infection to detect the big problem with the infection of trypanosoma. And this is an example. So here we found 49% of dromedary camel infected with trypanosoma evency. It's a high percentage with a herd seroprevalence of 73%. This is just an example for the risk factor of individual level infection with trypanosoma evency, that we found that the semi-intensive system is a risk factor that with the infection of trypanosoma evency. And in large farm, we found a lot of trypanosoma evency. And also within this area where watercourses are dependent, are a lot of watercourses, we found a lot of Trypanosoma evansi seropositive cases. There's a lot of tables like that in goat and equine, but the most important is in camels. This is the glossin, the tabanidi that can affect camel and is mechanically transmitted weight. For the genomic work and for the biomorphological work, so it's very relevant that we found new haplotype of Trypanosoma evansi in Algeria that were identified. In this figure, in the form of 5 polymorphic or secretine site and 2 alignment gaps or missing data, leading to exhibition of 4, as we see, 4 different haplotypes with a rate of gene diversity, considering to 0.8. The heterogeneity was located at the 3rd region, and the 3 region, as we can see here, in the region of Al-Wad, the region of Biskra, and the region of Gardaya. Overall, this is a significant variable site at position 207, and for parsimony and for analysis that we worked on with different species. Phylogenetic analyses were performed with all different representative haplotypes, including our Algerian sequence. The unrooted tree topology shows that each haplotype clustered separately, including the 2 new haplotypes from Algeria. This is the 4. This is the 4 that we found in our study in Trypanosoma evansi in camels. So this is the first work on biological molecular biological characterization of Trypanosoma evansi in camels, that we found 2 new haplotype, either never described in different regions in the world. So in conclusion, genetic diversity of Trypanosoma camel, Trypanosoma evansi among dromedary camel from Algeria has been demonstrated, and 2 new haplotypes have been identified. This novel finding can serve as the basis for future study of Trypanosoma evansi genetic diversity. Nevertheless, additional study, including more samples from different hosts and geographic areas, are needed to fully understand the extent of distribution of Trypanosoma evansi haplotype in Algeria. And thank you for your attention.
Now, all 6 topics are presented in the session 4. Do you have any questions and comments on all 6 topics? Yeah, Professor.
Thank you. I have a question to the last topic about Trypanosoma evansi. I'm much interested about Trypanosoma evansi. In fact, so also human beings. You mentioned some countries of evansi in humans, like India. Am I right?
Yes.
In Algeria, in your country, and in India, do you have more specific data of human infections? Is it just rare cases or kind of common cases? Because we don't have this parasite in Korea, I just wonder.
Yeah. Thank you. Thank you for the good question. It's very important to mention that, yes, recently, it's just recently that we have a lot of data about Trypanosoma eventually infection in human. It's documented in Sri Lanka, I think, in India in the first time in India and in Egypt. But unfortunately, in Algeria, we don't have data about the human infection of Trypanosoma eventually, and it's in our perspective to work on this topic.
Thank you. Is there Dr. Singla online yet? From India. The Indian case was the first one. Long ago, I remember some human cases from India, but I just wonder about the status of Evans infection in humans. But I don't think. Yeah, Dr. Singla, do you have any information about that from India?
As far as India is concerned, Professor Om,
yes,
Trypanosoma evensi is highly prevalent in India. I conducted my work, experimental work, as well as prevalence work. Here, as far as bovines is concerned, Trypanosoma evensi is more prevalent in bovines.
Oh.
He has presented on camels. Similar to camels, in bovines also, they act as carrier. We are not able to detect most of the infections in canines through blood smear examination or microscopically, because here in two forms of infection is there. One is paroxysm stage and second is intermission phase. In intermission phase, the parastemia is very low, which is non-detectable. However, when we conduct by molecular means or by serological means, as the presenter has discussed the card agglutination test for trypanosomonas, which has been developed by one Belgium lab, we have used by that. Serology for epidemiological purpose is more important. Similarly, molecular diagnosis for detection of the current status of infection is important. So in our state, we have conducted main work on cattle and buffaloes. Buffalo population is more, which act as a carrier status, and this acts as a nidus for spread of infection to other animals, especially susceptible horses and dogs, canines. That's all.
Oh, so in India, you have evansy in bovine animals, bovine animals, and it causes great economic loss also.
Yes, because of chronicity of the infection, there is a lot of losses of meat, milk production, even sheep or goats, wool production or meat production. So economic losses are important.
Okay, thank you very much for your kind answer. Thank you very much.
Thank you.
Professor Udoy also have some question. Professor Udoy.
Thank you, Tilak, for giving me the floor. I have just a little query about the reliability of ITS-1. For our fasciolar research, what we found, like ITS is a spacer, and it is very much unstable and recombinogenic. So my question is, how reliable is ITS 1 or 2, whatever it is, for molecular characterization of trypanosoma?
Anybody want any comment?
Sorry, I didn't hear well the question.
I have some comment. In my experience, we were trying to use it for trematode taxonomy also, and we've used ITS1 and ITS2, but unfortunately, as you mentioned, not very good for identification between the species. So if I were you, I would recommend CO1 or that kind of functional gene of mitochondria. That's my comment.
Yeah, it should be like that. COX1 or any single copy gene should be a very good marker for molecular differentiation or characterization of trypanosoma as well. Thank you.
I also have some comments. First of all, I would like to discuss about the presentation of Professor Uday. Thank you very much for your nice presentation. Actually, I'm very much interested about this kind of work. So this is really a good thing for the taxonomy, because as from literature we know the Linguicula serrata belongs to the Cephalopenidae, but your research try to make some taxonomic resolution. I just wonder, for this molecular evidence, what is the correlation between the morphological evidence to prove this one? Because here I show you also did the whole morphological examination also. Do you find any morphological difference between these two order?
Actually, thank you, Dila. We didn't go for a detailed morphological contrast between these two orders. Instead, we just focused on the members of the family Linguaculidae, and the previous taxonomy was based on completely the morphological features. And for parasites, specifically from our experience, from our group, it is like for taxonomy, you should not only rely on the morphology or only the molecular properties. There are too many issues actually, and we do not have enough time to discuss all the things here. But anyway, for characterization, you must correlate both the data, for example, the molecular data as well as with the morphology. Unfortunately, the data so far we have in Linguacula, we have several morphological data, but they didn't go for detailed morphology as well. And in our study, we found only one report where they included detail for morphology as well as molecular properties. And our data also supports that only one previous study where they considered both the data. But unfortunately, when you go for taxonomic resolution by molecular data as well, you will not find enough data. And probably you could observe, like the taxa we included in 18S ribosomal DNA and COX1, you can see that number of taxa is limited to COX1. So actually, for complete resolution of the taxonomic position, we need to have more data from diverse taxa for both the order Cephalopenidae as well as Porocephalida. So actually, we are not at the point to make a complete resolution right now. So we need to wait to get some more data actually on the molecular characteristics of different members of both the orders.
Thank you, sir. Actually, I will be grateful if I can join with you to research about this foodborne zoonotic nematode, zoonotic parasite later. So hopefully we have chance to learn from you. Thank you, sir, for your nice presentation today. And my next comment for Dr. Munkha Jangal. I'm sorry if my spelling of the name is wrong. Are you here? Dr. Munkha Jangal from Mongolia. Maybe offline. It's okay. By the way, thank you for your nice presentation also. Is there any other comment from participant? Maybe no more. So I would like to request our chairman, Professor Son, to continue the session.
I will close the final session. Thank you very much.
Thank you, Professor Son, for this nice session. It was really an interesting session with lots of knowledge. And thank you all presenters to share their research and knowledge with us. Ladies and gentlemen, it was the last scientific session for the second International Parasite Resource Bank Symposium 2021. On behalf of the scientific committee, thank you all for making time in your busy schedule to join us here last 2 days. I would like to express thanks to advisor of Parasite Resource Bank, especially Professor Hamida Khanum and Professor Laxman Das Singla, along with Professor Udoy Kumar Mohanto, also Dr. Shafiul Alam for guiding us. It also our pleasure to host the event. Now I would like to request Professor Kesson S. Om, Chairman, International Parasite Resource Bank, for Thanksgiving speech and closing remarks. Before that, I am Tilok Chandranath, from Department of Parasitology, Chumbuk National University, Korea. Would like to say you bye. See you again in 3rd International Parasite Resource Bank Symposium 2022. Bye-bye.
Dear colleagues and fellow researchers and honorable guests, thank you for your participation in the second International Parasite Resource Bank. During the meeting, we had 20 topics of speech, including 4 invited lectures from 10 countries at the venue of Chungbuk National University, headquarters of Korea. For 2 days, we've exchanged our experiences and information in the light of Corona and post-Corona pandemic. Some of the speakers participated by providing video clips due to the big time differences between the 2 countries. Dear my colleagues and friends, regardless of difficulties of Corona pandemic, we'll meet again in Denmark next year for 2022 ICOPA as a satellite meeting. We look forward to seeing you all in 2022 at ICOPA. Thank you all. Thank you very much.